Good morning, everyone. Welcome. We're excited to have you join day 2 of Michigan Women in Finance's virtual conference. For those who were not able to join yesterday, I'm Allison Hayden, president of Michigan Women in Finance, and I know many of you from my role at Baird, serving as municipal advisor to municipalities, school district, and various state authorities here in the state of Michigan. Hopefully everyone was able to join and enjoyed the program yesterday. We were able to celebrate some accomplished and amazing women in recognizing our honorary chairs, which included Jane Gillow, accounting and budget manager of Schoolcraft College, Joyce Parker, deputy state treasurer, Kimberly Pinchak, finance director of Farmington Public Schools, and Tricia Wiggle-Bazzi, deputy treasurer of Hamburg Township. We had an inspiring and insightful discussion with State Treasurer Rachel Eubanks about how to be leaders and how to get out of our own ways sometimes and keep pushing ourselves to embrace our capabilities. We also heard about her ties to this organization, even going back to her mother, Sarah Eubanks, being a founding member. And I actually think we had 3 of the founding members in attendance yesterday, including Sarah Eubanks and Catherine McClary and Suzanne Schenk, which is really neat. We also were able to hear a little from Treasurer Eubanks about the economic environment and how the pandemic has had impact not only on consumer behavior, but also on women participation in the workforce. Hopefully everyone also enjoyed the truthful presentation from Colette Carlson about how we manage on a day-to-day basis. I feel like many of us, just from reading the chat commentary, could certainly feel Blue Eyes pain as she really illustrated for us how much we truly carry throughout a day. She also talked to us about the little and big changes we could make in order to help ourselves be a little more selfish and focus on our own happiness and health. Hopefully everyone also had an opportunity to join the networking tables and get a chance maybe to say hello to a colleague that you haven't seen in some time, or maybe you were able to meet a new face. I did speak yesterday about how I'm sure we would all prefer to be sitting across the tables from one another throughout this program. We certainly never expected to have a 2021 virtual conference. I know I, along with many of us, are missing the aspects of the in-person conference and being able to step away from the office and connect with this amazing group. Very hopeful that that will be in the very near future. So appreciate everyone making the most of this virtual platform. Today, we'll continue the program and theme of Explore the Possibilities. I think this organization is a group that shares a common thread of being passionate about having an impact on our communities and fostering that to explore our own professional possibilities, and also use that to help others explore their possibilities. Today, we will talk with Wendy Block of the Michigan Department of Commerce about how our workforces and businesses begin to rebuild after the pandemic. We'll hear from Dr. Renee Kennedy about advancing diversity, equity, and inclusion. And we'll also hear from Marilyn Sherman about acting on our visions and taking actions to claim our seat of success. I do have the pleasure to be in front of you today virtually. However, there's a whole amazing team and board who really came together to bring you this program today. I introduced them yesterday, but I wanted to also bring up the PowerPoint again, because I think we weren't able to see all the faces that truly made this program come together for your enjoyment today. So I did want to run through. So our Vice President first, Annette Jones of Stiefel, our Treasurer, Dina Reed, our Secretary, Katrina Desmond of Miller Canfield, and our Board of Directors, which include Kristen Angel of Public Trust Advisors, Stephanie Griffin of TCF Bank, Christine Griffiths of PFM, Janice Hersey Anderson of the Michigan Department of Treasury, Desiree Kirkland of the City of Lansing, Michelle Lewis of Plant Moran, Glenna McDonald, who was our former 2020 president, Natalie Neff of Oakland County, Elisa Schwartz of Great Lakes Water Authority, Meredith Shanley of Huntington Public Capital Corporation, Jane Sarman of the City of Hastings, Chris Stury of the City of Southfield, and Carrie Shea of Clark Hill, Whitney Swanson of Comerica Bank, and Cindy Willoughby of Grosse Pointe Academy. We truly are a working board, so I just commend all these ladies for all the work that went into yesterday and today. A few housekeeping items before we jump into the program today. With the Zoom webinar format, just like yesterday, I know everyone is muted currently, but we will have time for Q&A after each of the speaker sessions today. So we just encourage everyone to submit Q&A. I believe if you're in the HOVA app, there is on the navigation pane a Q&A segment for you to be able to do that. Some of you might also see it towards the bottom of your screen. If for some reason you can't locate it, feel free to drop it in the chat box as well. We'll have someone monitoring and we'll look for those also. And then if you're having any issues, I mentioned this yesterday, but please email our info@michiganwomeninfinance.org if it's with the HOVA platform, and we'll try to provide some assistance. I also encourage everyone throughout today to continue to interact in the chat and interact in the HOVA app. I know a lot of you have been doing so already. I think we had over 600 messages exchanged between attendees yesterday, which is awesome. So I just strongly encourage everyone, if you haven't already, to go to the app. I know I've certainly been enjoying seeing a lot of the interaction and some of the community board topics that are being discussed. Now that we are covered housekeeping, it's my pleasure to introduce our first speaker of the day, Wendy Block, the Vice President of the Business Advocacy for the Michigan Chamber of Commerce. Wendy Block joined the Michigan Chamber of Commerce in 2004. The Michigan Chamber of Commerce is a statewide business organization representing approximately 5,000 employers, trade associations, and local chambers of commerce. Wendy is the Chamber's chief lobbyist and is responsible for leading the Chamber's government affairs, engagement, and training programs. Wendy has worked in and around Lansing political circles for 2 decades. Prior to joining the Chamber, Wendy served as a policy advisor for the Michigan House of Representatives and held other policy-related positions in the Michigan House and Senate. A native of Holland, Michigan, Wendy graduated from Loyola University in Chicago. She has been identified by lawmakers, lobbyists, association executives, and executive branch officials in MERS Insider Survey as one of Lansing's most effective single-issue lobbyists. Wendy will talk to us today about picking up the pieces from COVID and where do we go from here. With that, I will welcome Wendy. Thank you for joining us, Wendy.
Great, thanks, Allison, and thank you to Michigan Women in Finance for the invitation to join you here today. So we're gonna kind of jump right in. I have a PowerPoint that I think they're gonna pull up here. But as Allison mentioned, my name is Wendy Block. I'm Vice President of Business Advocacy and Member Engagement for the Michigan Chamber. The Michigan Chamber is a statewide business organization, so we represent over 5,000 Michigan employers across our great state in all 83 counties, across all industries, and our members are really diverse. They're across all industries, but they're the biggest of the big and the smallest of the small, is what we say. But about 80% of our members are small businesses, which we define as 50 or less. So in terms of what I do, I wear a number of different hats at the Chamber. One of them is a lobbying hat. Don't get scared by that term. We're not all bad guys, but really am focused on advocating day in and day out for Michigan businesses and job providers across our state in the state capitol. We advocate for pro-business policies, for free enterprise, and just really are focused on helping our members navigate through the legislative process. We also work to elect pro-business candidates to office. So when people are considering running for office, we offer an endorsement process. And also we do follow up to make sure that the courts are interpreting the laws that we're working on as intended. So we work through the legal process as well. So before we get going here with the PowerPoint, I just want to encourage you all to submit questions in the chat box. We're going to cover a lot of ground this morning. There's been a lot of announcements this week regarding COVID restrictions. So we're going to hit some of those things. It's pretty complicated stuff, but I'm going to do my best to explain kind of what's going on and what it means to you. Just want to make sure that this is interactive. So we will leave some time for questions at the end. But if we could pull up that PowerPoint, that'd be great. So today's topic is about picking up the pieces from COVID. Where do we go from here? I think a lot of us are trying to figure out, what does this new normal look like for all of us? So first slide, please. So really, I think as you probably know from your social circles and in your workplace, there's still a heavy focus on COVID cases in our state and around the nation and certainly around the globe. So these numbers are just slightly outdated because of when I had to submit my slides. But as of May 13, we had about 972,000 cases. I think we're up to about 978,000 as of yesterday, just under 20,000 deaths. The good news here, I mean, of course, that those are grim numbers, right? Is you can see here how cases have begun to slide back down very significantly since when we hit that peak, that high peak in late March. And we've actually seen a more severe decline in cases than we did even going back to late fall. So some good news here in terms of how we're turning the corner on these things. And I think we have vaccines certainly to thank for this sharp decline. Next slide, please. So vaccines, as I mentioned, are seen to the key to recovery. You'll see here the vaccine coverage rates that, we started out kind of slow, a little bit bumpy. A lot of states did with availability and access and kind of starts and stops about who could get vaccines first and the order. But you saw really here a pretty sharp or gradual incline in vaccine rates, but they really have leveled off at this point. So there's still some concerns, and we'll talk about the governor's vaccine to normal plan here in just a little bit about the thresholds loosening restrictions to vaccine rates. There are some concerns about, kind of where we're going with vaccines and this leveling off that we're seeing. Next slide. So, when we talk about vaccines, there's certainly disparities. And here you can see the racial disparities between the vaccines and kind of what's going on. Certainly, there is some hesitancy in racial groups. And let's go to the next slide. There's disparities by age. I mean, look at this slide. So 75-year-olds, in terms of their actual completion rate, we're at 69%, 75% have gotten at least one dose. But when you look here at, say, the 20 to 29-year-old group, which is certainly our working age population, you're only at 24% with 2 shots in the arm, 32% with 1. Now, we can account some of these differences based on the fact that the older populations were, of course, some of the first in line to receive vaccination rates, but really that does not fully explain the story. So we need to do a better job here of getting our young people vaccinated to really hit those thresholds that the governor has outlined in terms of reopening the economy. Next slide. And then this here too shows the racial disparities, coverage by race. You can see here, there's certainly the white and the Asian populations are some of the highest vaccinated, as well as the American Indian. Others are lagging behind. Again, these are data points that the governor and her team are focused on. How do you bring vaccines to these communities, meet people where they are, and really educate them on the process and that sort of thing. Certainly, not everyone is going to choose to get the vaccine, and there's going to be a lot of good reasons that people don't. Don't get me wrong. I'm not suggesting that everyone should, because maybe they have health issues that prevents them from doing that, or religious reasons. But certainly, I think they want to see the coverage by race equal out here across all of our racial differences. Next slide. So the governor has outlined, as I mentioned, a vac to normal plan, kind of cleverly named here, about tying vaccine rates to the lifting of restrictions. Actually, yesterday, they announced some changes, pretty significant changes to this, and have moved kind of away from this in some regards, still very much focused on vaccines. But the governor, when she first announced this on April 29, we were at 48.8% vaccinated rates, and outlined kind of these 4 steps to get to lifting of restrictions. Step 1 was getting to that 55% mark. That was when the governor said, we're going to ease the restrictions on in-person work, let people get back to the offices, remove this restriction that MIOSHA put in place that requires all employers to have their employees working remotely when their work can feasibly be completed remotely. This has been kind of a significant rub with the business community, just in terms of other restrictions that didn't really seem to match up, that, people could go about everything else in their daily lives, but they couldn't go to the office, and, suffering productivity, suffering on the innovation and collaboration front. We did hit that mark here just shortly after this was announced, in fact, and beginning May 24, offices will be allowed to reopen for all employees, regardless of whether that work can be completed remotely. We believe that that is, at the chamber, that is a good first step. Of course, there's other restrictions that still exist and that had been outlined in other steps of the Back to Normal plan that are still out there and that we need to work towards easing. Let's go to the next slide. So as you can see here, and as the Back to Normal plan outlines, the goal here is 70%. The 70% was the goal, and I think it's still the goal largely, but to fully reopen. The governor yesterday announced that we are moving away from just relying solely on this Back to Normal plan. We are going to get more details on Monday about what this exactly is going to look like. But I think a lot of that has to do with the fact that really we're not seeing, as you saw in that chart, we're not seeing the same sort of uptick in vaccination rates as we once were. So this is from last week, we're at 55.6%. Today, we're at 57.1%. So when we started this, we almost jumped, we've started and jumped almost 10%, but really have seen a leveling off. And there are serious questions about when we might even be able to hit that 65 or 70% mark. A lot of people feel like that is still very much a stretch goal. It may not be until fall that we actually hit these marks. And so yesterday, the governor, let's move to the next slide. The governor made some announcements, and it largely has to do with the CDC stepping in late last week, as many of you have probably heard, in updating some new guidance. So as of last week, and you all probably know this because you go to the grocery store and you go to, wherever, and you've seen the sign saying you don't have to wear a mask if you're fully vaccinated, meaning 2 weeks after your second dose, or 2 weeks after your first dose if you're getting the J&J vaccine. And the CDC kind of came in, to everyone's surprise, kind of threw the states a curveball and said that fully vaccinated people no longer need to wear a mask or physically distance in any setting, indoor, outdoor, except where it's required by federal, state, local, tribal, etc. laws. And that would include local businesses and workplace guidance. So this kind of put the Whitmer administration in a bit of a pickle, because we've had these MDHHS orders, Michigan Department of Health and Human Services orders, as well as Michigan Occupational Health and Safety, MIOSHA rules requiring mask wearing regardless of vaccine status. So as of last week, and this happened all last Friday, pretty late in the day, Michigan started to follow suit. But Michigan has a lot of rules that are overlapping. So the MDHHS order was a great step in the right direction, but they didn't really move on some of these other things. And when the epidemic order got issued last week, they said, okay, we agree, we're following the CDC on mask wearing, but we're silent on the social distancing piece. So that piece still stands as of today in terms of fully vaccinated people. And let's go to the next slide. And basically they said this, so effective May 15, so this was, I think started this week, I'm losing track at this point, that they're no longer going to require, so this is a state, people who are outdoors, they don't have to wear masks regardless of vaccine status. So if you're outdoors, even if you haven't been vaccinated, or you're not at your 2 weeks, or you haven't gotten your second shot, you don't have to wear a mask anymore. Entirely your choice if you wish to. Indoors, fully vaccinated Michiganders no longer need to wear a mask, but if you're not vaccinated, or if you haven't completed your vaccinations plus the 2 weeks, you do, under these orders, need to continue to wear a mask to protect yourself and others. They have said that after July 1, this broader indoor mask mandate will expire. And that's kind of what the CDC is saying, is that come July 1, regardless of whether or not you're vaccinated, masks will no longer kind of be required. Again, maybe a local business may require them, but the state and federal government are not going to require these things. So let's go to the next slide. So as I mentioned, the problem with all of this is while the MDHHS orders were a step in the right direction, there are still other restrictions that exist and contradictions. Late yesterday, and actually on Wednesday and Thursday of this week, the state started to move to fix some of these contradictions. So as of Wednesday evening, the state, or maybe on yesterday, I'm sorry, I'm losing track of time. The state started to move on some of these gathering and capacity restrictions. So the state said yesterday that beginning June 1, capacity limits will be lifted for all outdoor settings. So good news there in terms of outdoor, no more capacity limits. Indoors, they're moving everyone to 50%. Some industries are already at 50%. Others are not. And so everyone will move to 50% capacity on June 1. On July 1, they're saying there will be no more capacity limits at all. Some of these details will be announced further on Friday. So yesterday was just kind of an announcement in this regard. We believe that on Monday, you'll also see some, and this is kind of insider information, if you will, some lifting maybe of the curfew and some of the other restrictions that specific industries have on hand. Another big development, something that's not as much talked about though, is these MIOSHA rules. So we have permanent or emergency rules in place that MIOSHA has put on all workplaces. So this governs the employer-employee relationship. This is where you get, say, if you work in an office and you've seen your employer's preparedness and response plan. This is why you have to do that daily health screening before you go to the office. This is where you get the enhanced cleaning and sanitation requirements, where you get the mandatory isolation and quarantine requirements, which duplicate some things in other places, and on and on. This is where you got the remote work, that you have to work from home regardless of, kind of how you feel about it potentially, because MIOSHA had said so. We believe that those emergency rules will start to better match up with the MDHHS orders starting on Monday. And the other thing here is that MIOSHA has been talking for the last month or two about promulgating or putting into place permanent COVID workplace rules on employers. They were working on a process that's about 6 to 12 months out. So these wouldn't even go into effect for another 6 to 12 months to make these emergency rules, all these requirements that I just talked about, the preparedness and response plan, even some language that requires employers to have a policy promoting remote work indefinitely. They were talking about putting all of those things in place. We are told, as of an announcement yesterday with the governor, the Senate Majority Leader, and the House Speaker, that MIOSHA is going to be withdrawing those permanent rules. This is something we have been very focused on for the last couple of months, calling on the administration to withdraw those rules. So yesterday was a significant breakthrough in terms of kind of where we're going with these indefinite COVID restrictions and just kind of this what I would call micromanaging of the workplace that's been going on now for 14 months and really didn't have an end in sight until this announcement yesterday. So some really good news here yesterday. And, just really kudos to the governor for, I think, listening to public opinion on these things. We know public opinion is dropping here, especially as more and more states move towards reopening indefinitely. In fact, Michigan is only one of 7 states that until yesterday really didn't have a date certain for reopening its economy. So Indiana fully reopened, Wisconsin fully reopened, Illinois has a June 11 date for fully reopening, lifting all restrictions. Ohio has a June 2 date, again, same thing. Kentucky has a June 11 date. Really, with the exception of New Jersey and New York, we're really one of the only states that really is continuing to keep its thumb on citizens and businesses with its restrictions. So I think really good news here, good progress, and it seems appropriate given the fact that we have vaccines available to anyone who wants it. You could pretty much walk in anywhere today and get that first vaccine in your arm. And so with the rates of COVID also going down, we think this is the appropriate time to be talking about these things. And it looks like we're kind of on the road here to seeing some of those restrictions lifted. Next slide, please. Okay, so this is kind of where we translate from, what's happening to now what? Like, again, back to the title of the presentation, picking up the pieces. Where do we go from here? So let's dive in on that. Next slide. Okay, so we wouldn't have thought that this was going to be the case 3, 4, 6, 14 months ago, frankly. But right now we are in a position where we are in a severe talent crunch across our state. Every day I have chamber members calling me and telling me their stories about how they cannot find the workers that they need. I just talked to somebody the other day, a Subway up north. $18 an hour, benefits, signing bonus, you name it, they're offering it. They still can't find the workers they need. And this is not just in the hospitality industry. It's certainly more pronounced there, but it is across all industries. And you can see here, the monthly jobs report from April, we expected there to be a significant increase in monthly payroll the job growth. But we only saw a 266,000 person increase. And, I think a lot of that was surprising. I mean, that's across all 50 states. Unemployment nationally remains around 6.1%. So very high, especially given the demand that is out there for employers to find workers. In Michigan, we're a little bit better than that. I think last time I checked, it was at 5.5%, but still quite high, certainly not back down to pre-pandemic levels. And, the concern obviously is that the jobs are there. We're not doing a great job of matching those that are currently on unemployment or looking with those jobs. Next slide. So, in general, though, I'd say industries are experiencing recovery. You can see here the retail trade industries, kind of their blue line, that's their trend line. The accommodations and food services still lagging behind. That has something to do with talent, finding the workers. It also has to do with these capacity restrictions that we're continuing to see nationwide. Even those that, are allowed to go to 100% capacity, they just can't find the workers to fill the shifts, or maybe they've had to keep a number of tables, kind of put off to the side, or they just close sections. But we are seeing some pretty good recovery here. Of course, it all hinges on that talent factor here. Next slide. In terms of leading job openings, so this is from Career Builder, and it kind of indicates, so you've got, truckers, nurses, software developers. Those are the top jobs that are out there. But you're seeing here, retail is still fairly high, and customer service, marketing, etc. You're not seeing restaurants here at this point. Again, back to some of those reasons that I outlined. I would expect as we move towards full reopening, you're going to see some of those jobs more shoot to the top. And certainly this is a snapshot from Career Builder, so maybe isn't fully reflective of the whole economy. So just kind of with that caveat. Next slide. Who's hiring by industry? Administrative and support services are taking the top industry spots. The retail trades, are second. Healthcare, there were a lot of layoffs in the healthcare setting when we went to optional medical procedures in the spring of last year. I think that's reflective there. They're rebuilding, trying to get people in for all of these backed up procedures, manufacturing still very high here, relevant to those of you tuning in today. 342,000 people or industries or positions open in the finance and insurance industries. Really a great time to be looking regardless of the industry that you're in. And I think employers are getting really creative and trying to find ways to compete with each other here. Next slide, please. So, again, back to it's crazy time. I mean, we're hearing about job fairs where there's more employers than there are people looking for work. We're hearing about, situations where employers are paying people to interview, to just show up for the interview. It seems to be some ghosting going on where people are applying for jobs, but then not showing up either for the interview or for the first day of work if they've accepted the job. We're not really sure why that trend. We'll talk about the fact that right now unemployment work search isn't a requirement, so we're not sure what is driving that. But benefits are king here in terms of attracting good talent. Certainly wages are always going to be, kind of that number one factor. But retention bonuses, signing bonuses, you name it, they're trying to offer it to just get a leg up on the competition. So when we talk about why, right? I mean, there's, I think, a general, the press, they're trying to summarize this problem and maybe zero in on one of the issues that's driving this. But there really are a lot of reasons that this is such a problem. Quite frankly, this was the number one problem about a year, 14 plus months ago, and for, full 2 years prior to that. So, we're just kind of seeing this problem again rear its ugly head. There's some other factors driving it this time around that are more pandemic specific, that's kind of seeming to be pouring some gasoline on fire. One of those reasons is the American Rescue Plan, the federal stimulus bill that was passed in December, and it's a continuation of a previous stimulus proposal, which gives people an extra $300 on top of their state unemployment benefits. So in Michigan today, you can make about $662 per week on unemployment. That will run through September 6th. Actually, it's slightly earlier than that based on how our benefit period is calculated. But this is putting people in a difficult position. If you're making if you were going to reattach to the workplace and only going to make $15 or an hour or less, it actually makes financial sense for you as an individual to stay on unemployment, because potentially you could be making more on unemployment than working. And I know, my husband and I have talked about this situation at home, and it's hard to put yourself in that spot and to say, well, what would you do? Especially if you have some of these other things that are of concern in terms of childcare and other types of obligations. So that is becoming an impediment, I think, in some cases to people reattaching to the workplace. Of course, those benefits are not going to be around forever. They're set to expire in September. And in fact, in some states, they're moving to say thanks, but no thanks to the federal government for this extra $300. In other states, this is more of a problem because they have a higher state weekly benefit amount. So I think I should have looked this up before we started, but in Boston, for example, or Massachusetts, I think their state weekly benefit level runs upward of $1,000. So you're talking about $1,300 per week, potentially, in unemployment benefits. And that really gets you into like a high earner situation where you can make a whole lot just staying on unemployment and letting it run its course. So other states, I think, are feeling more of the pinch on this than maybe Michigan is. But we have heard from some of our members that when they try to hire and they bring people in at $15 an hour, the person will say literally, and I'm not exaggerating here, thanks, but could we talk again in September when my unemployment runs out? Because right now I can make the equivalent of that on unemployment. And that's unfortunate, because that's it's certainly a generalization saying that not everyone is doing that. Lots of people are out trying to reattach to the workforce, but there is some of that going on, and that kind of leaves a sour taste in many employers' mouths when something like that happens, and they feel like, gosh, I'm in a position of having to compete with government benefits, and just that kind of rubs some people the wrong way. Another reason is that we're not doing a good job right now of matchmaking employers and employees, or those people that are looking for work, together. So the governor put work search and work registration requirements, which are traditionally a condition of receiving unemployment benefits, on pause, going back to March of last year. Those things have remained on pause regardless, or without regard for the fact that there is this talent crunch going on right now. In fact, though, we have been advocating for the reinstatement of these requirements, and beginning on May 30th, they will be required again. And what that does is says to the person who's receiving unemployment, as a condition of receiving unemployment, you need to connect with your regional Michigan Works office so we can help matchmake you with opportunities, that we can talk about different job training programs that might be available for people out there, for example, or other educational opportunities like the Reconnect program or the Future for Frontliners program, which both offer free community college educations for certain types of individuals. We can get people linked up with apprenticeship opportunities and the like. So we do think that this is going to be extremely helpful in terms of just kind of making those connections, and not, putting unemployed people in a position where they have to figure out where to get started and what to do and maybe how to build the resume. Our Michigan Works offices are federally funded, and that's what they're intended to do. So good news there for employers that are working, maybe not a silver bullet, but certainly going to help. But other issues are those issues that we've been talking about for years, trying to solve and break down the barriers on. Affordable childcare is still very much an issue. I think, I'm a mom myself. I know how expensive it is to have a kid in daycare, and I only have one child, not multiples. And, just this question of, if you're going to work, does it even make sense? If you have to put a child in childcare, that all of your wages could potentially go towards paying for that childcare. So there's some opportunities here that we're working on as it relates to the federal stimulus money coming down to the state, the $5 billion plus, and to working to break down some of these barriers and make childcare more affordable for our working citizens. Another big issue is remote learning. Again, mom myself, understand the push and pull of trying to work a full-time job and also help your kid navigate remote learning. And, my son is not a kindergartner. I can't imagine that situation where I'm trying to do Zoom calls and also help my kid do Zoom calls and sit still and, not be running crazy around the house. So, we've had many issues related to getting people reattached to the workforce just because kids are still home in many situations. Certainly the skills gap, we need to invest strategically in breaking down those barriers. We support a number of programs that the state is running, some of which allow employers to receive grant money from the state through the Going Pro Talent Fund to help upskill employees, with retirements and other things. This is going to continue to be a major issue that employers across our state are facing. Affordable housing in many areas is very much an issue in terms of, the workforce and the wages that are being paid versus, the mortgages or the rent, and people just not being able to live in certain regions because the cost of housing is out of reach. Again, we're working on some strategic investments there to make that happen and focus on, trying to break down that barrier. A final issue, which is very real issue, especially in rural areas, but also our city centers, is reliable transportation. The cost of auto insurance is still very high in Michigan, despite some legislative changes, which has brought it down. But, regional transport and city transport still remains an issue. And as a state, we need to work to solve those problems so we can get people to and from work on a daily basis. Next slide, please. So really, we would say we need to all work together to solve this problem, right? We're talking about things like incentivizing a return to work, trying to get those 5.5% people that are on unemployment or some subsection of them to come off of those unemployment dollars and to reattach to the workplace sooner rather than later. Otherwise, employers are going to be in a world of hurt and not be able to recover in the way that we need them to, and hope that they will, for full economic recovery for our state. We've talked about, trying to offset, use some of that federal money to say to people, if you get a job off of unemployment and you keep that job for a certain amount of time, the state will give you a bonus. It's somewhat controversial because people feel like, gosh, do we really need to pay people more than a wage to come off of unemployment? But we are hearing from other states that they're doing these things, and it does seem to be moving the needle, at least somewhat. We need to reinstate those work search and work registration requirements. That is going to happen on the 30th. We have definitive news about that. That's come out in the last week. To invest in childcare is certainly, if you have connections with your state or state senator or state representative, we would encourage you to make your voice heard if this is an issue that you or your family members are facing. We need to get kids back into full in-person learning. I know a lot of moms out there can probably agree with the sentiment, the Friday, remote learning. My son's here doing that in another room. It's a struggle sometimes, we'll say. We need to invest in that skill building. So invest in some of these programs that the state has already established to get more people enrolled and to get people upskilled so they can fill the jobs of today, but also the jobs of the future. Invest in more affordable housing projects and break down those transportation barriers. I'd also say, as an employer community, we have to do more to get women reattached to the workplace. So, we talk about this she session, this female recession that's happened during COVID. Over 2 million women left the workplace in 2020. Some have returned, but not all of them. We're at the lowest workforce participation rates with women since 1988. And really, that is an astounding statistic. We've unearthed over the last year different social and economic inequalities, and they're really jeopardizing, a half a century of women's progress here, and they're hard-fought gains. And so, we're talking about women that are not only entry level, but women that are in senior roles. We're talking about mothers. We're talking about women of color, and the employer community needs to come together and to work individually to figure out how they can attract those women back. So there's a lot of discussions going on in the employer community right now about, how do you return or keep some of these flexible support models that have been put in place during COVID, and how do you make those permanent, but still without impeding your operations, or to work on more family forward policies that can help. Certainly, we believe those decisions should be made in the workplace, but there's certainly a lot of work that can be done here. I think the employers that are going to come out of this pandemic in best position with their talent and their workforce are those that look at this and look at it from more of a progressive standpoint. I don't mean that politically. I mean that in terms of trying to be forward thinking about making sure that their women are feeling supported, especially those working mothers who may need more flexibility than others. Next slide. So another key here is going to be working to rebuild our cities and downtowns. So our cities and our local governments have lost significant revenue. They've lost significant business due to COVID shutdowns. Our city governments, I know here in Lansing, about $20 million was lost during the pandemic in terms of revenue. That comes from property taxes being down because people left commercial space en masse. Businesses closed. Companies decided that they were just going to keep their people from home indefinitely, and maybe they gave up their commercial real estate. City income taxes are down with people not working in the cities where they traditionally have been working. They're working in suburbs, that sort of thing. And so there's usually you pay a different percentage of the city income tax if you're working not in our city centers. Parking revenue is significantly down. And so, there's going to be a lot of work that needs to be done here. I know when I drive through downtown Lansing these days, it feels a bit like a ghost town, and it's really quite sad just to see the number of local restaurants and retailers that don't seem like they're coming back. They've shuttered completely. Others talk about just, the significant loss of revenue that they've experienced because there is no foot traffic because people are not coming to work on a daily basis. This May 24 date in terms of reopening our offices is going to help, but I don't anticipate a situation where most employers are saying on May 24, we're going back, 8 or 9 to 5 a.m., 5 days a week, and that's the expectation. We're still talking about many businesses setting a date out, maybe after Labor Day. Some are even saying January 1 where they'll return, or they're saying, okay, we're going to come back, but we're going to come back with a hybrid model. So I think some of these businesses in our cities and downtowns are looking forward to the return to office situation, but they're not really sure what to fully expect in terms of how that might help and whether they can continue to hang on. And I think the real struggle here for many of these local businesses in particular is that, they spent the last 14 months just saying like, okay, I'll give it one more month. I'll give it one more month. Now they've drained their life savings and they're still trying to figure out how they can hang on for one more month. And, I take these stories so personally. I hear them and it keeps me up at night because I can't imagine being in that situation and just not really knowing what to do and really, myself not having good answers for really how this might play out. You want to give people some optimism, but you also, don't want to be too optimistic if it doesn't, and be in a position where you're having to say, yeah, gosh, we got that wrong. Next slide. Okay, so how can we work together? I like to think through this just because I think there's a lot of opportunities to think creatively. And, I think our cities and our local governments have done an amazing job of stepping up and being flexible with businesses and trying to figure out different things to help them and to help them keep open, to stay alive during this time. They've looked at helping them, rethink their business models. A lot of that has had to do with zoning, where things that you would never have thought would happen in a million years suddenly happened overnight and continue to happen, with, businesses taking over parking spots on the streets. I mean, that's lost revenue for the city, right? I mean, maybe there's a revenue arrangement in some places, and other places there's not. Taking over parking lots that have been abandoned because people aren't coming into the office. So why not use it in another creative way? Allowing that sidewalk and street dining, working through DDAs, these downtown development authorities, on different solutions and grant programs to help people. These social zones, especially as we head into the summer, are going to be a boom for many areas because it would allow people to go from restaurant to restaurant or bar to bar and do some open carry, and just to be out and about and enjoying nice summer days, but not be necessarily stuck in one spot. I think these are going to be huge going into the summer. In terms of other things, I think we all love our state of Michigan and all of that it has to offer. We would encourage you to support Michigan's tourism industry this summer. I know a lot of us like to go other places, but in the summer, really is Michigan, Michigan's one of the best places to be. In terms of supporting our local businesses by shopping and eating, I think we've all been trying to do that, but let's continue. And I would say just with this workforce stuff, like we have to be patient. We have to be graceful. We have to continue to tip generously, knowing that hours are still reduced, capacity is still reduced, and just show these industries that have been hard hit some continual love, but also some grace and some patience. Next slide. So I like this kind of stuff, like, bucket list, like what can you do this summer, wrap your head around it. So I just threw on a slide there, but I think we're going to move into some questions, and maybe we can leave that slide up and to give some people some thoughts about what they could do, maybe even this weekend when it's going to be beautiful out. But happy to answer any questions that are out there.
Awesome. Thank you, Wendy, so much. A lot of great information and a lot to think about as we move forward. We do have some time for questions, so I'll welcome Dina Reed from the board, who's been monitoring the Q&A and chat.
Hi, good morning, Wendy. That was a great presentation, full of great information that we'll probably all have to digest. But thank you so much. One of the questions that we did have come in was, what is the most positive thing that you experienced or have heard people have experienced during quarantine?
Oh gosh. I think what I was surprised to learn is that in some areas of our state, businesses have had the best year ever, right? You talk to businesses in the UP and in Northern Michigan, and they say, oh my gosh, like we have had the best year ever because, people were cooped up and they decided to take a road trip and to get out in the wilderness and to go and do some crazy hiking or kayaking, or I was talking to a mayor up in Charlevoix and he runs a skydiving business. And he was like, we have been running gangbusters on this stuff. So I tend to think like a lot of this was negative for our small businesses, but the campgrounds, the kayak places, the skydiving, all that, and I think that's amazing. I think it's like, trying to get a bike last spring. I was trying to get a bike and it was kind of frustrating, but I'm like, how amazing it is that like there's so much demand for bikes and that people are just like wanting to get out in the fresh air when maybe they've not even ever considered riding a bike before. So I don't know. That's kind of my take on it, is like there is some positive stories here. And I think we've all kind of had to rethink and reimagine our lives and our weekends and all these things, myself included. And I've done some things that like I haven't done in a long time. And it's been pretty great. And I'm planning to do a lot of those same things this summer.
That's fantastic. And I think, yeah, we've all heard that. So that's great. Thank you. One other question was, has there been any discussion about enhancing tax incentives or tax credits for people who are taking on additional expenses due to working from home? So, and I'm seeing this more broadly, as I talk to multiple employers in state and out of state, they're actually starting to push like even IT costs, actual hardware equipment and things where, they're asking you to get your own equipment and that sort of thing to support their business. So has there been any discussion or thoughts around how we might be able to incentivize people to work remotely longer term by incentivizing them and maybe in a tax credit or something like that?
Yeah. So I don't work on our tax issues, so I'll be honest, like I'm certainly not a tax expert. I work on employment law and healthcare issues and some other things specifically. But yeah, I mean, I think there's some general discussion about that. I think there hasn't been a rush to move to that because I think everyone was hoping that we would have moved past this remote work requirement before now, and just this feeling that was that going to be needed in the long term. But now I think we're starting to see that some companies are saying we're not going to come back, or we're going to keep certain segments of our employee population home long term, and that there needs to be more serious conversation about that. And I think there's also an opportunity there to talk about that in the greater context of some of this federal money. And really being able to make that a win-win for employers and employees alike is to use some of that money creatively, with some tax incentives and help employees who've been put in a position of having to take on more costs, but then not, kind of just having to say, well, employer, you need to pay when the revenues might not support that either.
All right, thank you. That's all we have from Q&A, and thank you so much.
Yeah, thank you, Wendy, for being with us today. You certainly put a lot of things into perspective and gave us a lot of information to think about. And it's certainly interesting to hear. I mean, I think we're all hearing about the challenges facing getting people engaged back in the workforce, but it's nice to hear some of the strategies that are being thought about of how to kind of help that. So really appreciate your time. Normally we'd present you with a speaker gift at this time just to thank you for and show our appreciation for you really taking time out of your day to be here with us. But we did send to you a bowl from the Holland Bowl Mill. So hopefully you enjoy that. And we just really thank you again for your time today.
Thank you. It was nice to be with you all. Have a great one.
Thanks so much. Now I will move to introduce our next speaker today, Dr. Renee Branch Kennedy, who is the Chief Executive Officer of the Michigan Public Health Institute. The Michigan Public Health Institute is a unique public trust dedicated to advancing population health through public health innovation and collaboration. Before joining the Michigan Public Health Institute, Dr. Kennedy served as Health Officer and Director of the Ingham County Health Department. She led the expansion of the innovative and nationally known Ingham County Health Equity Social Justice Program. Dr. Kennedy has held faculty and leadership positions also within the College of Nursing and College of Medicine at Michigan State University. She's been highly influential in broadening the discussion of equity and social justice, with serving on numerous national boards, review panels, and advisory groups, including the Robert Wood Johnson Foundation, County Health Ranking Scientific Advisory Group, the National Collaborative for Health Equity Advisory Committee, and Governor Whitmer appointed Dr. Kennedy to serve on the State of Michigan Coronavirus Task Force on Racial Disparities. She earned her PhD from Michigan State University, a master's degree in public administration from Western Michigan University, and a bachelor's degree in public health nutrition from the University of North Carolina at Chapel Hill. So today we have Dr. Kennedy to talk to us about advancing diversity and equity and inclusion and a call for authentic leadership. Welcome, Dr. Kennedy. Thank you for joining us.
Thank you, Allison. And what a great session you're having. I was really intrigued by the prior speaker. Many of the points that she made, though they used an economic frame, are really health and well-being points as well. So hopefully you'll see this as a great segue. I am going to endeavor to share my slides. So let me see if I get this correct. Does that look right? You're seeing my slides and not my notes?
Right now, it's not showing screen share for me.
All right, let's do that one more time.
So right now we can see the PowerPoint. There we go. Perfect.
There, and you see the PowerPoint, not my notes.
Yes.
Perfect. Okay, so I really just want to give you some things to kind of stir your thinking this morning. I'm just looking at my clock, so I make sure we're right on time. So I want to, this talk is about you, and it is about you in the context of where we live, work, play, pray, age, the settings of our lives. And I am assuming that if you are a woman in finance, that you are a leader, because there have not always been women in finance, right? So we'll talk a little bit about that. So I want to share with you some of my DEI leadership assumptions. The first is that relationships are primary. My favorite relationship quote says, relationships are primary, all else is derivative. There is not anything I would submit that we accomplish outside of relationship. And I consider myself a relationship-driven person, a relationship-driven leader. As a leader, it's really important for us to understand the assumption that trust is earned and not given. A lot of times we just sort of expect, because we're in this role, that of course people are going to trust us. But have you presented yourself in a way that is trustworthy? Remember that our experiences are all, and our realities are all very, very different from each other. We grew up with different messages. We live in environments with different cultures and different priorities. And so expecting and respecting that our lives are very, very different. My grandmother, who passed away at the age of 95, a beautiful Southern Black woman, used to tell me, honey, everybody grinning ain't tickled. And really what she meant by that is I have the responsibility to build authentic relationship with people. Are we saying what we mean? Are we meaning what we say? It is going to require sincere and authentic relationships for us to advance equity and diversity. I would also submit that this is head and heart work. This is not just what we do as our job, but it is who we are as a person. And so we really want to think about what we know, but also how do we feel about what we know? And then lastly, my chief financial officer taught me this, this value, and it is tone at the top. And she was explaining to me, this may be something you all, of course, know, that when you look at organizations that are at risk for fraud, that when you're doing forensic accounting investigations, that looking at what was the tone set by the leader is hugely important in terms of assessing risk. And in the space of DEI, the tone that leaders are setting is also really, really vital. So those are my assumptions. I want to encourage you to find your why. Like, why would you want to be a leader who applies diversity, equity, and inclusion? And I also want to encourage you to lose your why bother, because this is hard work, and there will be people sort of naysayers saying, why are you bothering to do that? Let's just treat everybody the same. And, this is too hard. Well, you got to lose that why bother. And I'm going to give you two justifications, I think. If you'll see this clip on the right side of my slide, it is just a clip from the 1970s, the Gila Bend Herald, that's in Arizona. And the story says, no news value at all. Two little girls just playing peas porch hot on the school grounds don't have much news value. They're not like racial riots and the interracial council meetings and big quarrels about school integration. However newsworthy or not, they're a lot nicer to look at than pictures of the big city's tear gas throwers. This was 1970, but we could probably put 2020 on this and still see relevance in that little storyline. There is much that has changed across race and our relationships as framed through race, but there is a lot that goes unchanged and that we still have work to do as leaders. And I'll just confess that little girl playing peas porch hot, the one sitting on the water fountain stoop, happens to be Renee Branch before she became Renee Branch Kennedy. But I share that with you, one, for its intent, but also, again, to challenge you to find your why. What's your motivation? I love this quote by Sheryl Sandberg, who's the COO at Facebook. And she said, I want every little girl who's told she's bossy, and maybe every woman who's told she's bossy, to be told instead she has leadership skills. Not only do we still have issues around race and equity across race, we still have work to do across gender. And so I want to do a couple of things. I want to show you an example, a case example that might be a role model for you. And then I want to give you, just kind of prod you with a little bit of a model as well. So Lillian Wald lived in the late 1800s and early 1900s, and she was a nurse, a humanitarian, an author, but she just did not do business as usual. This quote point says that she became disillusioned with institutional methods, particularly for caring for children, and started pushing on the system. Like, are you willing to push on the system? So we all have different identities. I'm an African-American woman, I'm a doctorally prepared woman, I'm a Christian woman, I'm a middle-income woman. And so those identities, in terms of the context of our nation, are either sort of included or sometimes they're othered. We have a history of being othered as women. And so if we think about Lillian Wald's identities, she was white, she was middle class or owning class. She did not have a disability. She spoke English. She was born in the US. She had a college degree. She had high status in her organization. Those are all things that we value. But she also was Jewish. So in a predominantly Christian nation, being any faith other than Christian can be a disadvantage. She's a woman in the late 1800s, right? And she worked on behalf of children and youth. So social service is not business, right? Not high finance. And so I encourage you to think about what are the sort of included privileged identities that you have so you can use that power as an asset, and what are the areas that sometimes get marginalized so that you can have compassion for and understand those who live many parts of their life being othered and being marginalized. So I would submit that in order to advance diversity, equity, inclusion, we've got to see differently, we've got to say differently, and we've got to do differently. So let me just give you a couple of little points there. What do we mean by seeing differently? Take a look at this slide. And it is a poster from a few years back by the American Red Cross. Love the American Red Cross, former board member in my own community's Red Cross. And it was a pool safety poster. Be cool, follow the rules. Good message. But then people began to notice that all of the not cool behavior was being demonstrated by Black and brown kids on the poster. And all of the cool behavior was being demonstrated by the white kids. Now, did somebody sit in a conference room and say, oh, let's make sure that white kids are not doing anything negative? Of course not, right? Our own biases, our own influences in from our culture, from our society, influence that frame. And this was the unanticipated consequence. And I will submit that I push us in this work, particularly from an American frame, one, because I've lived, well, not all of my life, but most of my life in the United States. But I do this honestly as a space of patriotism. I love this country. I grew up in a military family, which is why 3 years of my life were lived in the Philippines. My brother is a West Point grad. I love this country, and we not only can do better, but we must do better. So being able to see differently and see right off the bat. Now, if we were in a conference room together, I'd be saying we do this as a bit of an exchange. And I'd be asking you, what do you see on this slide? So let me let you think about that for a second. What is that? It is actually a thing. It's not a Rorschach spot that you get to interpret. It's a real life thing. Some people have said, oh, is it like a Google map is it a satellite map? Is it a forest? So let me tell you what this is so you can see differently. If you said this was a cow, then you did indeed see accurately. Some of you guys are going, a cow? What? You're trying to figure it out. Well, hopefully you can see my cursor, but on the far left, this big black blob is an ear. And it angles down kind of through the middle as the bridge of the nose of the cow, and then down to another dark blob, which is part of the nostril. The other side is another nostril. And then you see this large ear next to an eye. It's a cow. We have to train ourselves to see things not as we are, but as they are. We tend to see them based upon our own experiences, biases, preferences, likes, dislikes, and that leads sometimes to misinterpretation. So an example from Lillian Wald, our woman leader role model. Here's a quote from her. She actually grew up in upstate Rochester, New York, as I said, a wealthy family, but she chose to work in the tenement housing of Harlem, in the city of Harlem, where people had far less than what she had. And so she is quoted as saying, it is very pleasant to return to my old home. In coming back to Rochester, I inevitably compare the physical advantage of children who are brought to manhood and womanhood in this environment with those of the children with whom my lot in life has been cast this many years. She is seeing differently. She didn't just make assumptions that, yep, everybody will have the same thing, we'll just facilitate that. And not only did she see differently, but she found her passion through what she saw. So saying differently. DEI leadership, I would submit also, is framed not from having all the answers, but from asking the right questions. That's the hard part. A lot of times people don't want to have conversations around diversity or equity or inclusion. I don't want to say the wrong thing. I don't want to, if somebody asks me something, I'm not going to know how to respond. But it's not about having the answers. It's about having questions. And so when you find yourself stuck in a place, move to curiosity, to wonder, wow, I hadn't thought about that. Can you say more about your experiences or your feelings? Have the right questions. We talk about this in what we describe I'm a sociologist by training. So in sociology, we talk about this in terms of a dominant narrative. Like what are the customary ways that we say things in this society? And one of the definitions there says that recognizing a dominant narrative asks us to dig deeply into long-held assumptions in a web of meaning that's mostly invisible, mostly unexpressed, and mostly taken for granted. And I would submit, mostly prone to offending people who are different than ourselves. And so are we willing to dig deeply into those assumptions? Yeah, we don't really talk about that because everybody knows that. Do they? Let me throw out a couple of examples of where just some prime examples of the need to say differently, because your words are powerful. And they're powerful, one, because words are simply powerful. They set tone, they create, they establish culture. But your words are words of power, because if you're on this webinar, I'm assuming you're employed, that's a position of power. I'm assuming you're educated, that's a position of power. And so powerful words from powerful people have even more impact to heal or to harm. So avoid othering in your words. And I always talk to my HR leader about this term fit. Well, we're going to let them go. They're just not a good fit. What does that mean? What are we saying when we say that? So think very deeply about the words. When I was, as Allison mentioned, I was on faculty in the College of Nursing. I'm a medical sociologist by training, as I shared, and my colleagues who were nurses would consistently describe me as the non-nurse. I don't know if you guys ever used the term the non-accounting or non-financial people, but I would argue that you've got to define people not by what they're not, but by what they are. I'm a sociologist, and every time they'd say non-nurse, I would say, I'm not a non-nurse, I'm a sociologist. And they would just laugh, or they'd say, that's just so much extra work, to remember to say that. More work for whom? For you or for me, who's left with the wound, right? There's also a thin line between generalizations and stereotypes. And making a statement and then saying, I know that is a generalization, but is still perpetrating generalizations that then set people up to hear skewed messages. And so if we're going to share an experience of an individual or of a couple of people, share it as that. Here's a story that I was told. This is important context for us to know, but don't get in the space of generalizing, because that leads to overgeneralizing, which leads to stereotyping. And then your powerful words have negative context. Is this a lot of hard work? Yeah, it is, because we still have work to do, right? We are not the generation that is being hosed with the fire hose or attacked by dogs and all of the challenges of the 60s. But the baton has been passed to us, and we do still have work to do. This is not about being politically correct. This is about being authentic. It's about being relational. It's about building deep interactions with people who share different values. How much more enriching is that? Here's an example of Lillian Wald saying differently. She says, it is a serious loss in the individual child to have a free food kitchen associated with the schools. Now, if we stop there, we'd all go, what? Huh? She continues, their most precious gift, if foreign born, if they're immigrating to this country, is the absence of class distinction in the public school. The public school, she says, is the stronghold of democracy. Saying differently, a little counterintuitively, right? Because we were probably patting ourselves on the back. Well, we have free breakfast programs. Well, if free breakfast programs are causing students, children, adults to be alienated, to be marginalized, then we're not doing as much help as we think we are. Let's move on to, now we've talked about saying differently, seeing differently, saying differently. Let's land at doing differently. I love this quote from Jack Dixon, and he says, if you focus on results, you will never change. If you focus on change, results, you will get results. Counterintuitive again, because we are taught as professionals, what are the results? What are the outcomes? Certainly as a trained researcher, that was the message, that was the narrative, that was the mantra. We had to focus on outcomes. We had to focus on results. Well, we are in a season of change leadership. If you've ever seen John Cotter's book, Leading Change, it's a great one. We cannot continue to do things business as usual because our society is different. COVID has shown the light on real difficulties across communities that we have. And are we going to stand up as leaders, particularly leaders who are women, and push us to a space of results? So let me give you a little self-assessment, and you can reflect on this, because sometimes we really do need to get out of our own way. This assessment comes from nursing. Larry Purnell is a transcultural nurse. He does work in cultural competence. And he talks about our ability to engage people across difference as being based on consciousness. Are we aware of it, the need to do it? But also competence. There's a skill. Are we able to do it? And so he says that we go through this continuum, right? We start out at this space described as unconscious incompetence. These are the people that don't get it, and they don't get that they don't get it. They're just like clueless. I don't know why we always pick on somebody's uncle at Thanksgiving dinner, right? We always say, Uncle so-and-so at Thanksgiving dinner, he's always saying X, Y, Z, and we go, Uncle Fred, you can't say that. And he goes, what are you talking about? What did I say? I didn't say anything, right? Clueless, they don't get it, and they don't get that they don't get it. Fingers crossed that none of you guys are there, but if you are, be honest with yourself, there's room for growth. Then we move from this unconscious incompetence to a space called conscious incompetence. We know we have an awareness, we just haven't perfected the skills. So when we say something, it's like, foot in my mouth, shouldn't have said that. We know immediately, we self-correct, consciously aware, but incompetently still uncomfortable in the doing. We then transition to the space called unconscious competence. That is those are people who get it right sometimes, but they don't really know why they got it right. Like they're not sure they can replicate it. They're just sort of like, whoo, glad that worked out. That was fine. Yikes. Yeah, maybe you're in that space. The other place we go then is a space called conscious competence. And that seems like the goal, but I'll share with you why I think it's not quite the goal. Conscious competence, I think about, I survived teaching or learning three teenage sons, and they're driving. I don't know if you guys have any teenagers and you survived. Our prior speaker was talking about school age kids. I'm going to talk about teenage and adult kids. Conscious competence. So when my son would get in the car, he knew what he was supposed to do, man. He was putting on the seat belt, and then he was checking the rearview mirror, and then he was moving the seat up or back and checking the outside mirror and turn the radio down 11 and 3 on the wheel and check the blind spot. And in the meantime, mom is in the passenger seat going, can we just go? Just go, just go, just go. He knew what to do. He was competent, but he was also very, very conscious of it. And I think sometimes that's where people push back on this work of equity and diversity and inclusion, because it's like, this is so unnatural and I don't want to have to think about this all the time. Well, Ed Purnell asked me to add to his model, which he hasn't, but I will add, there's this other space called maybe subconscious competence. Like, it's just a part of our subconscious. It is a natural part of what we do. When I get in the car to drive, I, of course, do all those things that my son did. I've got my seatbelt on, I'm checking the radio, I'm checking the rear view mirror, I'm doing all of these adjustments, but it's second nature. A lot of you probably drive home from work and like, I didn't even think about that drive home. It was almost autopilot. It becomes so natural. That's where we are aspiring to be as leaders in diversity, equity, and inclusion. But why aren't we? I found that I got to a place of being really, really frustrated with, I'm just going to call them cowardly leaders. Like, where are the courageous people? So I started reading about, maybe it was risk taking. Maybe people just aren't comfortable. And I found this work by Margie Worrell, and she just simply talked about 4 reasons why people don't take risks. The first one, she says, is we overestimate the probability that something will go wrong. Yep, I am knocking on that bungee cord. I'm gonna be the one out of a gazillion times that it happens. It'll happen today at 4:15, right when I'm on it. We overestimate the probability. The likelihood is that bungee cord is gonna be fine, but we overestimate the probability that it won't be. The other reason why we don't take risks is that we exaggerate the consequences of what will happen if it does go wrong. Man, that elephant on that tightrope, that's going to be a mess. They're going to fall for sure. And then it's going to be a disaster on the ground. Maybe, maybe not. Maybe there's a lake that's just the appropriate depth. Maybe there's like a ton of brush that he's going to fall into. Who knows? So we don't want to exaggerate the consequences of what will happen if it goes wrong. The third thing she says is, well, maybe it might go wrong, but we underestimate our ability to handle it. If something goes wrong, we can handle it. You can steer that glide flyer right to where it needs to be. And I would submit that most importantly, she says we don't take risk because we discount the impact of inaction. We're fine. Why would we need to change? Yep. My colleague used to say, a fish doesn't know it's wet until it's out of the fishbowl. We've got to jump out of business as usual, our typical status, our typical norms, understanding that there is more left to do. Take some risk. Doing differently, quote from Lillian Wald. Now, Lillian is considered the nurse who founded public health nursing. As a matter of fact, she created that term. And she would just argue, why, again, in these tenement housings, why am I going to try to push a mom at 6 weeks postpartum to find her way into my clinic? It's so much easier for me to just go to her clinic, go to her home. Why would I do that? Well, you can't do that. You can't. Well, now, decades later, that's a norm. Of course, we do home visits. She says, over broken asphalt, over dirty mattresses, heaps of refuge we went. There were 2 rooms and a family of 7 not only lived here, but shared their quarters with boarders. I felt ashamed of being a part of a society that permitted such conditions to exist. What I had seen had shown me where my path lay. She saw it and didn't say, this is horrible. She saw it and she said, we've got to do something about this. And so let me just leave you. I opened with some leadership assumptions. Let me give you some leadership agreements. 1, practice both and thinking. We are socialized to think either or. Either it's this or it's that, but most times it is both and. Push yourself in that regard. Also notice intent. We sometimes will say, well, I didn't mean to offend you. Or we'll do that awful apology where we say, I'm sorry if I offended you. Well, of course, you know you offended the person. That's why you're having to apologize. It's not about your intentions. It's about the impact that they had, your actions had, taking responsibility to improve those. This is uncomfortable work. Increase your comfort with discomfort. It's almost like putting on that new pair of jeans or that jeans after you just wash them. Once you wear them for a while, they get much more comfortable. Having conversations about race and difference and othering and inclusion can be uncomfortable until you get used to it. It is okay to disagree. We're not trying to get people to become automatons, right? But it's not okay to shame, to blame, and to attack each other. I would also offer this for your consideration. We are taught that the most fair thing to do is to treat people the same. Ironically, sometimes the most unfair thing you can do is to treat people the same. Treat people as they need to be treated. And you, as a person of power and of privilege, the burden is on your shoulders. It's not, well, I've arrived and so I don't have to do this all. No, to whom much is given, much is required. So one of my colleagues had his rabbi says, sometimes it's easier to change the world than to change yourself. We've got to do both. And sometimes we avoid looking deeply at ourselves and we just focus on that out there. We've got to do both. And that little girl, Renee Branch Kennedy, not only survived the gas throwing difficulties of the 70s, but she grew up to be the mother of 3 adults. I won't tell you which one of the ones was driving me crazy as we drove. But I encourage you to, as your theme says, explore the possibilities. Don't get tired of doing the right thing. That's my Renee Kennedy translation of this quote. It will be worth it. In the end, we will all benefit if we don't throw in the towel. Thank you so much for including this topic in your agenda today.
Thank you so much, Dr. Kennedy, for opening up this very important discussion. So many great insights that really just make us stop and think. We do have some time for questions, so I want to welcome Dina Reed back from the board just to see if there's any in the Q&A and chat. Hi, Dina.
Hi, good morning, Dr. Kennedy. Thank you very much for your comments. We had a couple of questions come in, so I'm just going to start there.
Super.
One of the questions was, in what areas do you see the most diversity and inclusiveness?
That's such a great question. We are all products of our environment, whatever our sector is. And so I kind of see the same trends across most sectors. It was a little bit like Wendy was talking about transportation and housing and daycare. We see the same types of patterns if we're not intentional. I'll just give you an example. When I came to MPHI, I was the only person of color on my senior leadership team. My employment demographics were about 11% people of color. We now have about 50-50 people of color on my executive team and 28% in our workforce. So none of us are immune to this, but it does require intentionality. I'll confess, I could have a leadership team of all doctorally prepared Black women, because I know a lot of doctorally prepared Black women, but I had to choose to kind of walk out what I think is an important value for this nation.
Thank you very much for that. And who do you think, or where do you see the most struggle with equity and diversity?
Well, I mean, certainly we've seen a lot of struggle right now in terms of police engagement with communities. I again, though, say that is a product of our environment. And I just want us to all be courageous enough to be the excuse me, but person in the room. Have we thought about this? I mean, we've come to this boil because we've not been having dialogue, deep dialogue that's shifting narrative and value. We sort of have these uncomfortable conversations and then say, well, let's just not talk about it. If we watch the news, it shows, but we also know in terms of healthcare that with COVID, we've seen twice the impact, twice the number of deaths amongst Black and Native American people, especially in Michigan, than among white people. That should not be the case.
Great. Yeah, thank you so much for that. And I think, I really take personally your points about us being in a leadership role in a position to actually make a difference. And I know that I'm sure that everyone who's on here today has really benefited from at least the idea to make sure that we're thinking. It is hard to be courageous in that room when you might be in any sense the minority, right? And depending on what that status is. And I've been there too, but it's different, of course, but it's similar. And it takes a lot of courage to speak up and just say, no, we need to do this. So thank you for those thoughts and those ideas on how we can push that through.
Yeah, can I tell you a quick story? When I was at MSU, I got sent to a meeting on infant mortality because I had done that work before. I went into the room. It was a room with like 6 men. And I was so confused. I'm like, is this the infant mortality meeting? And they're like, oh yeah, come in. They're like all over the place. And though I finally said, get courageous. They all have PhDs. I didn't have a PhD yet. So I'm like, okay, I'm just going to say this thing. And they just looked at me like I had turned purple in the middle of the room. I'm like, come on, I'm the only person in this room that can even have a baby. Surely you have to value my opinions. But so I got the smackdown in that meeting and used that to fuel my determination to speak up in the next one.
I really appreciate you sharing that because I too have been the only female in a room on more occasions than I can count. And, just having people like you to look up to and remember that we can make a difference and we should, and it's our responsibility to do so. So thank you for those examples.
Yeah, I certainly echo all of what Dina said. Just a lot of great thought-provoking points that you brought up today, Dr. Kennedy. And I really loved your point about moving to curiosity and having the right questions. I mean, I think that's really where it all starts and kind of that shift of kind of how you look at something and take that step. So thank you so much for being here with us today and providing us with this discussion. Also, normally I'd present to you a speaker gift just because we really appreciate the time that you did spend. I mean, I know you're very busy and you took time out of your day to be here with us. So we did send you a Michigan-shaped bowl from the Holland Bowl Mill as a token of our appreciation. So thank you so much for joining us.
Thank you. Thank you so much.
Well, great. Now we'll go ahead and transition into a break. So hopefully everyone will have some time to take a break here, maybe catch up on some emails or grab a snack out of your giveaway basket here before we start off at 11 o'clock with Marilyn Sherman. So please join us back at 11 o'clock. I know Marilyn has a great presentation here for us about taking the front seat in leadership. So we'll be back here at 11. Thanks, everyone. I'm excited to introduce our keynote speaker today, but before I do, I just want to mention if for some reason anyone's having trouble viewing both a presentation and the speaker, there should be a link at the bottom of your HOVA screen that allows you to join through Zoom as well. So I just would encourage you, if you're having any issues, to try to join via Zoom through that link, and it should be a pretty quick connection there. So as I said, I'm excited to introduce our keynote speaker today, Marilyn Sherman, the founder of Front Row Leadership. We actually have a video today to play to introduce Marilyn. So we'll go ahead and play that now.
It is my pleasure to introduce Marilyn Sherman. Since graduating from Washington State University, she has spent years working with high-performing teams and leaders, teaching them how to get out of their comfort zone and live and lead from the front row. Her keynote messages are based on her motivational books. In addition, Marilyn offers workshops on reducing conflict in the workplace and managing change with a positive mindset. Forbes.com named her latest goal-setting book as one of the top leadership books in 2019 for new managers. You'll soon discover why she's on several top speaker and keynoter lists and is one of 185 members of the National Speakers Association's CPAE Speaker Hall of Fame, and holds the highest earned designation for professional speakers, the Certified Speaking Professional. She was an artist in residence for High Point University and serves on the board of the Village of Hope, Las Vegas, an after-school program for grade school kids who are living at or below the poverty line. She lives in Las Vegas with her husband. Please welcome Marilyn Sherman.
Yay! Thank you very much. I'm so happy to be here finally with you. I wish we were all together in Holland live, but I did get my beautiful box with my Holland bowl yesterday, so thank you very much. And I really wish that I had a Women in Finance association to join when I grew up in Seattle, because after I graduated from Washington State University, my first corporate job was with a finance company. And I was very excited because I felt it was like my first grown-up job. And my first day on the job, when they had me fill out all the paperwork, they said, oh, by the way, we've made a mistake. The salary that we quoted in the job interview was different. So here, if you'll just sign this, this is your actual salary, which of course was a lot lower. And I was so naive. I didn't have a group of women in the finance industry who were further along their career than I was, that I could say, well, wait a second, can I, give me a minute, let me look this over. I need about 5 minutes. Let me come back to you. And I could have called somebody like you, any one of you in this association, to say, hey, is this normal? Is this right? Because I didn't have that, and I was naive, and I said, okay. And I signed the paperwork. And then after a while, they put me in a management training program, and I worked for this finance company for 7 years. But when they promoted me, they said, by the way, we love you, your energy. Do you have any friends? So I got my best friend a job at this same finance company. And we went to lunch after her first week. And I said, so how's it going? She goes, well, the funniest thing happened. On my first day, when I was filling out the paperwork, they told me there was a mistake in the salary that was quoted. And I said, well, that's not a mistake. You quoted me that fee or that salary, and I'm taking that salary. And I was so inspired that my best friend stood up for herself. And I just learned, we need each other. We need to support each other. And like Rachel Eubanks said yesterday in her amazing presentation, she said, it's been a tough year, including psychologically. So I'm going to check in with you. I want to know, how are you doing? I want you to go to the chat right now, and I want you to put in a number. So I want to know how you're feeling right now on a scale of 1 to cat. How are you feeling on a scale of 1 to cat? Because we've been on Zoom calls, we've been multitasking, we've been doing so much. And I know that I'm sure our conference planners are feeling like this right now. And at the beginning, maybe we sort of felt like an 8. So I'd love to see what you all are saying in the chat. Oh, look at this. We've got lots of 7s out there. Woohoo! It's only 8 o'clock in the morning here, so I'm not quite a 7. But I want you, because today we're exploring the possibilities. I want you to be like a 9 or a 3. I want you to be super curious about what you can do to get a front row seat in your life. And now, in order for me to talk about the seat of success and how to stay front row positive in a balcony negative world, I sort of have to explain to you, well, what do I mean by that? So let me explain to you my philosophy. My philosophy is that you and I, we are all living in this venue of life. And this venue of life has 3 options as to where we can sit. Those 3 options are, you're either stuck in the balcony, which in my world, the balcony seats are not good seats. Balcony seats are, you're so far away from what's happening. You are distracted, you're removed, you're disengaged. In fact, you could leave your balcony seat and come back and no one would have ever noticed that you had left. The second option in this venue of life is general admission. General admission is where most people sit. That's why they call it general admission. When my first book I ever wrote was called Whose Comfort Zone Are You In? So another way of saying general admission is your comfort zone. And this is where you say, hey, things aren't that bad. They're not fantastic, but they could always be worse. Here's the problem with living in your comfort zone or general admission. You get into a habit, and those habits lead to this is the way we've always done it. And this is the way I've always been. And this is the way, that's who I am. And that those habits leads to a rut, and that rut can lead to mediocrity. And I don't want any of us to live anywhere near mediocrity. So that's general admission. And then the final option is the front row. The front row is where you get to say, oh man, I love what I do. I love who I do it for. I am valued. I am heard. People invite me to the seat at the table. When I'm there, they don't interrupt me. They actually value my opinion. I was speaking at an HR conference one time and someone said, oh my gosh, if you're that excited and if you're that motivated and you're that energetic, it's either your first week on the job or it's your last week on the job. Well, today is all about exploring the possibilities, right? And I love our previous speaker, the first speaker today, and she said there was a back to normal, which I thought was a cute play on words. But I don't want us to be saying things like back to normal, because there's nothing normal about what we've gone through this last year. I want you to talk about back to the new future, because now is the time to re-engage, to reinvent, to re-explore who you could be and the possibilities of who you could be. And I know you have notes. I know you got these beautiful notebooks that were in our gift baskets. Image Master, one of the sponsors, gave us notes. I want you to write this down, or wherever you're taking notes, I want you to write this down up until today. Because the future is anything we want it to be from this day forward. So up until today, for example, if there's anything that has held you back, if there's anything that's held you in the balcony of your life, whether it's your physical chair, your relationship chair, your spiritual chair, your work chair, something about that chair that you've been stuck in the balcony when your vision is to be in the front row, there's something that's holding you back. I want you to think about what it is that's been holding you back. And then I want you, instead of describing yourself as that, I want you to say, well, up until today. Have you ever had someone who is perpetually late? And whether, like it's a girlfriend and you want to meet them for happy hour or for lunch or something, they're always late and they show up again late. And the first thing they say is, oh, I'm so sorry, I'm late again, but that's just who I am. Well, I want you to stop saying that. And I want you, whatever it is that you want to work on, I don't describe yourself as that. I want you to say, up until today, I've been challenged with managing my time, or up until today, I've been addicted to peanut butter M&Ms, which is the best food in the world. But anyway, so I want you to take a note of that, because I want you to shift your mindset. So back to my front row philosophy. Oh, well, wait a second. We're social distancing. So this is social distancing front row. But I want you to recognize that at the beginning of COVID, I want to ask you this question. I want you to put a big yes in the chat if this seemed like you. So imagine that this is your front row. Everything is sort of all going copacetic. Everything's cool. And then COVID hit and the world changed. How many of you felt like this? Put a yes in the chat if this was you. How many of you felt like you were completely knocked off your game, yet it seemed like everybody else was doing okay? Did any of you feel that besides me? Well, I'm seeing Sonia, yes. Rob and Tamara, yes. Tracy, amen, yes. You are not alone, Debbie. You are not alone, Elaine, because in reality, this is what the world looked like. No one was on their game. Everybody was turned upside down. Everybody's world shifted. So my background, I have a sociology background as well. And my first pre-corporate job was as a crisis counselor in Seattle. And what I did was I was a suicide prevention counselor, and I learned from Dr. Elizabeth Kubler-Ross the 5 stages of loss. And what's interesting is that 40 years later, the information, the skills that I learned as a crisis counselor have been brought back to the surface because people need these skills. So I want you to, if we're going to be front row positive in a balcony negative world, especially if you're a leader or a manager, I want you to recognize that there are 5 stages of loss that are, Dr. Elizabeth Kubler-Ross wrote them for On Death and Dying, her famous book, but they're applicable. These 5 stages are applicable to us today because we've all collectively experienced loss. We've had loss of normalcy, loss of routine, loss of a schedule, loss of having the freedom to go anywhere we want, travel or otherwise, or a grocery store without worrying about safety protocols. We've had a loss of having our own private time without worrying about wearing an additional hat, like a homeschooling teacher, which was not part of your skill set that you signed up for. So I want to briefly just remind you of what these 5 stages of loss are. The first one is denial. And believe it or not, there are still people to this day who are in total denial that COVID was even a thing. So if their mindset is still in denial, their language and behavior will be completely different. So denial is a stage of loss. The next stage is bargaining. This is where you start to figure why things are the way that they are, and you start to bargain. Well, if I only wore my mask and totally self-isolated every single day, I'm never going to get COVID. I'm never going to get sick. Or if only people would just stay in their own lane, I would be okay. Or if only the government told us sooner, we wouldn't have this problem. This if only game is all part of the bargaining phase. And when you're in the bargaining phase, it's easy to slip into the blame game or an understanding of, well, if I did this, then this is supposed to happen. And then you're disappointed when your expectations aren't met. And then there's anger. How many of you have experienced people who normally are pretty cool, calm, and collected, have all of a sudden like shown a really short fuse? Has anybody seen anger come out of people that they normally didn't experience? Or maybe even out of yourself, where things that normally wouldn't have bothered you have now suddenly bothered you? Well, it's normal. It's part of the stages of loss. Vanita, yes, absolutely. You and I both. So that is a stage, anger. Depression is another stage that we go through when we're experiencing loss. Now, if you have depression that is, it's a real thing. It is a real thing. I'm not talking about diagnosed depression and medication. I'm talking about the realization that, oh my gosh, things are closed down, or the realization now that, oh wow, things are starting to open up, but at a different pace than I thought. It's a realization that things are different, and there's a heaviness that it feels like it's depressing. So I know because I've been on these calls with my colleagues every Monday night since the pandemic started. And I know all of us have experienced a sense of depression, of a heaviness, of a load of low energy, of lethargy. And it's like, well, that's part of the phases that we go through. And then the last one is acceptance. This is where you say, okay, got it. The country shut down. We have to pivot. We have to create a whole new studio. 100% of speeches have been canceled in person, so we have to go virtual. Acceptance. This is where you say, okay, now what? What can we do? What do we need to do? What can we do to serve our customers, our constituents, and our patients? What can we do? Now, here's why this is so important for me to start out my presentation today. Because you cannot be forward-thinking, innovative, and creative unless you are in acceptance. And here's something else that I'd like you to know. Not only are you not alone, but everybody's going through it. So don't be alarmed when people are not as they're in different stages. So everybody's going through it, but they're going through it in a different stage. It's also nonlinear. So don't expect to, okay, I've gone through bargaining. Now I'm about to be angry. No, 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 no. You could bounce from total acceptance to all of a sudden heaviness of depression. And then you could go into anger. It's nonlinear. But since you're now aware of these 5 stages of loss, you can say, oh, okay, so this is temporary. Let me do something in order to move myself towards acceptance. There's no time limit for each, just like grief, there's no time limit for grief. So you go through what you need to go through, but I encourage you to see your way through these stages so you can get to acceptance quicker. And let's say you're working with a colleague or you're a leader and you have somebody that that supports you and you're their leader. It's okay for you not to know what to say. If they're going through a level of depression that's outside of your level of expertise, it's okay to say, I don't know what to say. Is there someone that you can call to talk to about this? Because I don't know what to say. And then people are constantly trying to figure out what's next with new protocols. As much as possible, be as transparent as you possibly can. And if your hands are tied and you can't disclose what's happening next, then you can say, my hands are tied, I can't disclose anything yet, but the announcement will be made on Tuesday. Be as transparent as you possibly can. So with that, I'd like to give you my seed of success so that you can see, so that you can live your life in the front row, that you can take your seat because you deserve it. You are valued. You deserve a front row seat in your life, unless you're not a very nice person and then, go hang out in the balcony. So here's my seat of success. Are you ready? Let's go. The S in seat, any good speaker has a nice acronym. So my acronym of seat starts with the S, which is to see the outcome you desire. Where do you see yourself coming out of this pandemic? Where do you see yourself? You can redefine yourself. You're going to be going back to work and going and seeing people you haven't seen in 14 months. I don't know if you're a hugger like I am, but I'm going to be hugging people a little extra longer because I've missed it so much. But where do you see yourself? Where do you see yourself a year from today? Where do you see yourself in the future? And the reason why you got to see it first in order for you to know how to navigate your path to get there, but you got to see it first. I don't want you to end up someplace by chance. Dr. Dennis Waitley taught me we move toward and become what's uppermost in our minds. So where do you see yourself? And the reason why I'm so passionate about it, because both of my parents were visionaries. My mom and dad, get this, they had 10, in 10 years, they had 8 children, 8 kids. In fact, here's the family, Linda, Mark, Dal, John, Lisa, Margie, and me. And this is me, I'm on the end going, hurry up, take the picture. I want to eat my watermelon. But my mom, she was, and still is an amazing woman. But here's one of my favorite pictures of my mom. This is her. She's bringing home one of her babies. In fact, I showed this picture to her and she goes, oh, I call that picture bringing home annual baby. And because my oldest sister was born in December, and then my brother in February, another brother in March, another brother in April. I mean, it was every year my mom was having a baby. So I showed this picture to my dad. My dad's such a macho guy. I said, hey, Dad, who's mom bringing home from the hospital in this picture? Because I know it's not me because I'm the youngest of the family. And my dad's reaction surprised me. He's like, I remember that car, which tells me about perspective. We heard Dr. Kennedy talk about that picture that I couldn't figure out what that picture was. I thought it was an X-ray until she said it's a cow. And I'm like, oh my gosh, it is a cow. Everybody's got different perspectives. So I want you to come from a place of curiosity, because you can't be curious and defensive at the same time. So if you want to stay front row positive, even around balcony negative people, don't be so defensive that they're so negative. Come from a place of inquiry, come from a place of curiosity, and ask them questions. And you divest yourself emotionally while you hear where they're coming from. And what's interesting in our politically heated environment that we're in, I've been in hot conversations, and I purposefully just wait to see if they're going to ask me a question. And people that are so defensive on their stance, they're not open to hearing your opinion. They never ask you a question. So I want to get into the habit of people saying, that's an interesting point of view. Tell me, how did you come up with that? Or tell me where that came from. Oh, that's interesting. That's new to me. Come from a place of curiosity. So you can still remain positive, even around sometimes hostile people, even if other people are defensive, if you are not defensive and you take a step back. So the S is to see yourself. And both my mom and dad would sit us kids down and say, okay, where do you see yourself next week, next month, next year? Where do you see yourself 5 years from now, 10 years from now? What are your tombstone goals? Write them down. Let's discuss. And I remember when he sat down with all the kids and he would say, okay, it's not about if you go to college, it's about which college you're going to be able to get into. So you have to get really good grades so you can get into good college. And if you don't choose a major by the end of your first year in college, you're going to be cut off financially. And I remember saying, Dad, I am only 6. So it was when we were very young, they taught us the power of visioning. So I ask you, where do you see yourself in this new future? You can create, the possibilities are endless, so you can create it for yourself. The E in SEAT stands for be energy focused towards your vision. Just like Colette talked yesterday about energy management and being present. I agree. It is not about time management, because you can have all the time in the world all planned out. But if you don't have the energy, you are not going to be capable of doing even the minute tasks that are on your to-do list. So I want you to be energy focused. You deserve to preserve your energy. Now I have this QR code up here because if you want to take a picture and get on my list, you will get an article that I wrote called How to Say Yes to Less to Reduce Your Stress. Because I want you to say no, but on things that divert you from your primary purpose, things that people are only asking you the question because you're the only woman in the room, for example, or you're so nice, you have difficulty saying no, so people take advantage of that and they ask you to do all the extracurricular stuff. So I want you to learn how to say no diplomatically, because although no is a complete sentence, sometimes you can't just say no and leave it at that. But what you can do, write this one down. This one's a keeper. I want you to write this down. Someone asks you for something and the scope of what they're asking you is not in alignment with the casualness in which they are asking you. You know, hey, can you do me a favor? And then you say, sure, without knowing the scope of it, you're dead in the water. So let's say you've learned how to say, well, it depends. What exactly do you need and when do you need it by? So always get clarifying questions answered before you say yes. And let's say the scope of it is much larger. You don't have the bandwidth. And certainly our bandwidth has shifted in the last 14 months. So you don't have the bandwidth. So here's how you say no. You say, I appreciate your trust in me to do this. I have a prior commitment and I will not be able to take that on right now. Now, what they do not know and what they do not need to know is that your prior commitment is to your mental health, to taking care of yourself, especially if you and I make a commitment today. I will not be taken advantage of by people who think that they can just give me work because they don't feel like doing it. And I'm a nice person. I can't say no without a tremendous amount of guilt. So if you say, I commit to taking care of myself, I commit to establishing boundaries of people that take advantage of me, and I commit to really taking care of my energy and preserving my energy. So now you're not lying when you say, I have a prior commitment. They're not going to ask you, oh, really? What is it? And when is that due? So that's how you take care of yourself. So the E stands for energy, be energy focused towards your vision. The A in SEAT stands for your attitude. And you know this as well as I do. This is nothing new. People want to do business with people that they know, like, and trust. And people like people with a good, positive, energetic, optimistic attitude. You do not want to be one of those people who is so negative about everything that the glasses always half empty and the sarcasm is always dripping. You don't want to be that person who brightens up a room just by leaving it. And I know people, they have walked out of a room and all of a sudden the energy shifted where everybody else in the room just sort of exhaled like, whew. it's like you didn't even have to say it. It's like, wow, glad that person is gone. So I want you to have an attitude adjustment. In fact, I want you to have an attitude like this next woman that I'm sure you saw on the news. This story just makes me smile every time I hear about it. This is a story of a woman who went on a job interview, and she nailed that interview. She nailed it so much that she did not know this. She went out into the parking lot and she did a happy dance. But what was so cool about it is that when she did the happy dance, she looked around first to make sure no one was watching. Check her out. She looks around. And then she does that, like, I nailed it. And then she just like casually like walks away to her car. And the interviewer the person who interviewed her saw it on tape on their security camera. And there's a backstory to this young woman, Kalia Jones. I think she's out of Atlanta. There's a backstory to her happy dance because she was homeless. She was living in a car. She was going from couch to couch from her friends. She did not have a steady home. And the only thing she had to wear for this job interview were house shoes. And if you look closely at this video again, you can tell she's wearing slippers. These are house shoes. These are not professional shoes. And the interviewer saw herself in this woman and gave her a chance. And when they were interviewed on national news, this woman said, before, when I was her age, I also was homeless. And I also showed up at job interviews with house shoes on. And I was turned away from even having an interview because of what I was wearing or because of what I wasn't wearing in terms of professional clothes. And because this woman showed up and I saw myself in her, I welcomed her in. And then her attitude was so energetic and it was so optimistic and so positive. I thought she'd be the perfect team member for our company. And so it was such a great story. So I want you to have this attitude. Do something today that makes you do a happy dance because people see it. Even when you don't think they're watching, people see it and they feel your energy. Sometimes it takes a shift. Sometimes it takes something to happen. For me, I had my attitude shift when I had a birthday that had a 0 behind it. Do you remember, turning a certain age? I know that for me, I think it was, I don't even remember how old I would turn, but it had a 0 behind it. And I had a pity party because I was starting to compare myself to other people who were younger than I was, and they had surpassed me in success. So I was jealous of people who were further along their career than I was in mine. And then I had something happened and I had a shift in my attitude and it changed everything. I was flying from Las Vegas, where I live, to Atlanta to speak for an HR conference with a layover in Dallas. And I made a rookie mistake because my client was picking me up for dinner that night as soon as I landed. I made a rookie mistake and I just wore my cute shoes instead of my travel shoes. Well, when you go to DFW, you never go to, your connecting gate is never right next door. And on this day, I had to hike all the way to the other side of the terminal and my feet were killing me. And I realized halfway through, I forgot my book on the plane, and I was reading a really good book about negotiating skills for women called Women Don't Ask. It was really a great book on negotiating skills. And I ran all the way back to the gate because I hadn't finished that book, and the gate agent was very nice. She went back on board. She found my book. She brought it to me. I'm so happy. So I'm going to the connecting gate. My feet are really tired. And I sit down at this new gate and I'm like, oh, I just forgot my purse at that first gate. So then I ran back to that first gate and my purse was completely unattended, just sitting there all protected by the angels. So now I have my purse and I have my book, but my feet are done. So I stop at one of those convenience stores and I buy some fuzzy socks. I sit down at the new gate and I'm feeling sorry for myself. And like any good party, you invite guests. So in my little pity party, I invited frustration. I invited anger. I invited resentment. I probably invited a little bit of Ben and a little bit of Jerry and maybe some Dawn and Juan and Jack. But then something happened. I looked up and there were 2 gates worth of passengers all standing up looking out the window. And I thought, well, this is odd. So I was curious. So I got out of my comfort zone and I approached a stranger and I said, excuse me, what's everybody doing? And he pointed out the window and he said, we're just watching this. And this is what I saw. It was an American Airlines flight with a luggage cart that was draped with an American flag. And look at all the ground crew in their safety vests. Right before I took this picture, they rushed into position so that they could be there to salute the casket of a fallen soldier. In an instant, I got grateful. In an instant, my whole attitude and energy shifted. And I was grateful for two very specific reasons. First off, I was grateful, so much reverence in which my fellow passengers and then the ground crew were paying towards this fallen soldier. Secondly, and more importantly, I was so grateful for the fallen soldier. I don't know if it was a man or a woman. I don't even know what which of the armed forces they served in. All I know is I am witnessing their final flight home. And who am I? Who am I to complain about having worn the wrong shoes walking through an airport? I mean, my problems were so trivial compared to what I was witnessing. And as I was basking in gratitude, it didn't take long for me to realize that I no longer had pain in my feet. And then it hit me. You can't walk in gratitude and sit in self-pity at the same time. And what I like about this, and this is the most quoted, most of all my speeches, this is the one quote that people retweet and post on Instagram or Facebook more than anything. But what I love about this quote is that you can exchange self-pity with anything that does not serve you. You can't walk in gratitude and sit in anger at the same time. You can't walk in gratitude and sit in frustration at the same time. You can't walk in gratitude and sit in anything that doesn't serve you at the same time. So if you're feeling any of those things, find a way to get into gratitude. So how do you stay front row positive, even around balcony negative incidents and balcony native world? You keep track. I call it a win list. I want you to get a journal, get this beautiful, nice pad of paper by Image Master, and I want you to start keeping track of all of your wins. So what's a win? A win is anything that makes you feel good. Anything that's a reminder of your value. Anything that's a reminder of your courage. Anything that's a reminder of how you were able to take a risk, step outside of your comfort zone, and you accomplish something that you hadn't accomplished before. A win is anything that you had a fear and you worked through it and you got to the other side and you're like, that wasn't easy, but it wasn't as bad as I thought. I want you to write it down. I want you to write it down so much so that the next time you have fear or the next time you have trepidation, the next time you have a lack of courage, I want you to go back and review your win list. And I want you to anchor to all the evidence that you are a strong, powerful person, that you are a strong, valuable, courageous person, because we forget. If 99 things go right in our day and one thing goes wrong, what do we talk about over dinner? Typically, that one thing that went wrong. And I want you to stop doing that. I want you to train your brain to focus on what's positive. Train your brain on what's going right in the world. So before I go on to the final letter in my SEAT acronym, I want you to put in the chat, if any of you have served in our armed forces, I want you to put me. Or if you're a mother of someone who served in the armed forces, I want you to put my son or my daughter, or if you're married to someone, I want you to put that in the chat, because, you know, we can know each other for a really long time in associations. Okay, Jane's husband, thank him for our service. Your son is in the Army, Laura, thank you, and thank them for their service. Your sister-in-law, yes. See, we're all connected to people. If not us directly, we've been connected to somebody. And wasn't Colette's story yesterday so powerful about her father? God bless him. I love that story. So yes, wow, Navy, Marines, brother and father, absolutely. So thank you for your service. because I know that it takes a lot of courage and patience and endurance on your part to be the mother or to be the wife or to be related to someone to support that person. If it's not you serving, boy, you do serve right along with them. So thank you for your service. Okay, the last letter in my acronym for the seed of success is to have your tenacity at full capacity, especially when facing adversity. So what you see here is my bucket. This is my bucket of dreams and hopes and aspirations. Just like I love how there was a bucket list of things to do in Michigan. I love that because I love a good bucket list. But you'll notice that my bucket that you're seeing here has holes in it. And this is because a year to the day that my father passed away, I woke up and weighed. I decided to weigh myself because my clothes no longer fit. And I literally gained 36 pounds in 1 year. Now, I'm not blaming all this weight on the grief of losing my dad. Because I've had a weight problem up and down all my life. It was just a realization that here I go again, that I've gained all this weight back. And I literally woke up and said, oh my gosh, why do I keep putting holes in my own bucket list? And then I thought, oh, well, that's a great title of a book. So I wrote a book, Is There a Hole in Your Bucket List? How to Overcome Fear and Other Obstacles That Prevent You from Fulfilling Your Dreams. So you'll notice on my screen that there are holes in my bucket. But there's also, do you notice down here that there are nails? And these nails are the things that have created the holes in the bucket. And these nails have labels. And before I reveal what those labels are, I want you to put in the chat, what do you think are self-sabotaging behaviors? What do you think are the things that we do that prevent our dreams from coming true? What do you think is underneath those labels on these nails? What is our self-sabotaging behavior? Just put it in the chat so I can see if you and I are on the same page. Let myself get distracted by technology. Absolutely. Doubt. Excellent. Fear. Excellent. Yes. You guys are smart. Oh my God. Negative self-talk. Yes. Oh, you guys are awesome. Yeah, you get it. You get it. You totally get it. So these were my specific holes in my bucket list. Comparison to other people, negativity, shame of once again failing, insecurity, like I don't know if I can actually do what I say I want to do, doubt that I could have success, and fear. Well, what if I fail again? I don't want to try again and fail again. Well, I got to tell you that you have to have tenacity. If any one of these things creep into your life, you have to have tenacity, and the tenacity to go through the fear, the tenacity to let go of the doubt, the tenacity to recognize insecurity. You're not alone. Everybody's got a smidgen of insecurity once in a while, and imposter syndrome. Listen, it's common and it's okay. Work through it. Have the tenacity to work through it. Shame, Brene Brown, Dr. Brene Brown is amazing. She talks about shame and how if you have the secrets that hold you back, when you shed light on it, those secrets have no power. So you let go of that shame by talking about it. You talk about it to people you trust. And it's this association of people who have the commonality of Michigan Women in Finance. You all have something in common. These are the relationships that you nurture and you grow so that you can share these things with, so that you know how to have the tenacity back at work to navigate the trials and tribulations, negativity and comparison to other people. So a quick answer on how to patch up those holes. A quick answer is, I like to say, you patch up those holes in your bucket list with courage, compassion, and kindness. The courage to see that you've got some holes in your bucket list and you have some work to do. Compassion, first and foremost, for yourself. Give yourself a break. Show yourself some grace. You've been through a lot. So allow yourself to pick yourself up and start over again. You can do it. And then compassion for other people, because maybe you're in acceptance stage, but there's somebody with, they're in denial, or all of a sudden they're super angry. Show a little bit of compassion, because maybe they're just not at the same stage you are at. So maybe you can be the one to listen to them. You could be the one to reach out and be a sounding board, be a resource. And then kindness. Oh my gosh, the world needs a little bit more kindness, don't you think? Well, my next story has compassion, courage, and kindness all over it. And it's again from another little boy in Florida. Oh my gosh, I could learn so much from kids and young people. This little boy did not come from money, but he had a dream and a passion for his favorite team, the University of Tennessee Volunteers. So he was so excited because his teacher announced they were having Spirit Day. And on Spirit Day, you could come to school wearing any of your favorite team's items, whether it's a sports jersey or a baseball cap or anything with the logo of your favorite team. Come to school dressed like that on Spirit Day. Well, this little boy told his teacher, I don't have an official shirt, but I've made my own. I'm so excited. I get to wear my own homemade Spirit shirt for the University of Tennessee. And she's like, right on, you got this. So he shows up to school and he's wearing his homemade University of Tennessee t-shirt. Don't you love this? The ingenuity of this little boy. He's got it like the big U and it says university and then of, and then the T. And he came to school and he was so proud. He was walking with his shoulders held back. He was just like, yeah, I love this team. And then at school, the teacher noticed his energy had completely shifted. When you see someone and they're not the same, their chair has been knocked over, do you check in on them? This teacher checked in on this little boy. She got down to his level and said, hey, buddy, what's going on? And he looked up at her and she could tell he had been crying. And she's like, what's going on? He said, there was a group of girls that made fun of him for wearing a homemade t-shirt. And he was the only kid in class who had the only homemade shirt. And they made fun of him. And he was crying because he was so embarrassed. Well, she immediately went to her resource, Facebook, and she said, does anybody have a connection to the University of Tennessee? I need a t-shirt or a baseball cap or something quick, because here's the situation. So like any really, really good stories, it went viral. And this little boy, a week later, had a box of swag that arrived to the school. 35 pounds of swag came in from the University of Tennessee. This little boy felt like a zero and he went to hero within just a couple of days. And this swag kept coming into the school and he got to share it with everybody, even the kids that made fun of him. But the story doesn't stop there. The University of Tennessee got a hold of the story specifically, and they decided, I've never been to their campus, but apparently they've got a big rock out front of campus. They painted it orange and transposed his design on this rock so everybody could see his design when they drove up to campus. And they turned it into their official t-shirt that year. And everybody started wearing these t-shirts. They had printers printing t-shirts 24 hours a day, 7 days a week to keep up with the demand. Everybody around the world started buying these University of Tennessee t-shirts with this kid's homemade design. And I love this. This is the chancellor who announced on this day that this little boy was getting a full ride scholarship to the University of Tennessee when he became of age. Don't you love that? It takes courage, it takes compassion, it takes kindness. And boy, can you imagine how good it felt for that chancellor to do that? So and a part of the proceeds went to an anti-bullying campaign. You and I can do this every day. With courage, compassion, and kindness, we can patch up holes in bucket lists everywhere. So I want to give you a recap of tips that you can specifically do to stay front row positive in a balcony negative world. So write these down. Tips for staying front row positive. I want you to anchor to what you know. There are going to be negative people out there who are jealous of you and resentful of you just because of your success. And there are going to be a sliver of people in our population who want to derail you. Sometimes it's consciously, sometimes it's subconsciously, sometimes it's with biting commentary in a staff meeting or in a boardroom. I want you to anchor to what you know. And you do that by constantly reminding yourself of the person you are and the person you are becoming. I remember back in college, I'll never forget this because I had it on posters in my dorm room my freshman year, because I started to watch motivational speakers when I was in high school. So I knew the power of visualization and I knew the power of affirmations. So my affirmations that I had on my college dorm room were what I wanted to be: motivated, dedicated, open-minded, level-headed, healthy, wealthy, and wise. So every single day I would wake up and I would see what I wanted to be: motivated, dedicated, open-minded, level-headed, healthy, wealthy, and wise. And what's really funny is now that the pandemic is coming to an end, I have a marketing piece that I'm sending out to all my speaker agents and bureaus and meeting planners: motivated, dedicated, and vaccinated, and ready to speak in person or virtual. So anchor to what you know, because there will be people who want to derail you. And when they do, you don't have to buy into it. Just be reminded of who you are and who you are becoming. So anchor to what you know already. And then keep that win list and add to that win list something that you can celebrate, something you've done that's courageous, something you've done to help somebody else, something that you've done to work through your fear. Keep that win list. Here's something I haven't mentioned yet, but it goes right along with your win list, and that is your humor file. You want to stay front row positive? I want you to keep track of things that make you laugh. Things that make you laugh and laugh hysterically. One of my goals in life is to laugh hysterically at least once a day. Laughing hysterically releases endorphins in the brain, and you get those endorphins released by either working out, eating chocolate, having sex, or laughing hysterically. Not all at the same time, but it even works when you fake it. And that would be the laughing part. So you can fake laugh just to get your energy. So the next time someone says, hey, you want to go work out? I don't need to. I'm just kidding about that, but I want you to just learn how to keep track of things that make you laugh. So if you're having I don't ever want to say you're having a bad day. In fact, I want you to eliminate saying you're having a bad day. I want you to shift it to say, I'm having a bad moment, because there is no such thing as a bad day, only bad moments that people choose to nurse all day long. So if you're having a bad moment and then another moment comes and you start to feel the heaviness of the depression phase setting in, go to your humor file and relive, reenact, rewatch anything that is on your humor file list so you can re-engage with the humor of life. One of my favorite things I saw this year that made me laugh hysterically, did you all see this? It was the lawyer who was on a Zoom call with a judge and he was trying his case and he was stuck on the cat filter. And he couldn't get off the cat filter. Did you see this? If you ever have a moment and you need to take a break in your day, just Google lawyer with the cat filter and you see the video. And the video, the cat is nodding saying, Judge, I'm not a cat. It's just hilarious. Something that happened to me when I was I was speaking pre-pandemic, and pre-Uber and pre-Lyft. I was at Orlando International Airport to go speak at this conference, and the cab line was really long. So I went to the front of the line because I don't like to wait in line. And I said, hey, is anybody going to the Dolphin Resort? Because if you want, we could share the cab and share expenses. And I had to take her. May not be the smartest thing to do now. We have obviously Lyft and Uber, but back in the day, this worked for me. On the way to this event, this stranger started a conversation. What brings you to Orlando? I said, well, I'm going to speak at this really big women's conference. And he looked at me and he gave me a strange look, but he smiled and he said, I love big women. I looked, I said, no. It's a large women's conference. He's like, I love large, baby. It just made me laugh so hard. And then when I got to this conference, there were 3,000 women there and they took over the whole hotel. And there were some men, like we have some men here today. And there were some men that were there. So they had to accommodate the women though, with the restroom. So they didn't just put a sign on the men's room door that said, gentlemen, your restroom has been moved to another floor. We're turning this into a ladies' room. I mean, they did do that, but then the meeting planner had a sense of humor and they took it one step further. And I thought, oh, that's hilarious. They put ferns in the urinals And then a competing organization was there to scope out the speakers. And then they recruited me to speak at their conference. And they took a page out of this playbook and they took it to another level. And I thought, okay, now that's going just a little too far. But if you want to water the plants, you just had to flush. So, so back to my recap of our ways to be front row positive. Show some grace. We just need to take a beat. The next time you have somebody that's short-tempered with you, show some grace and realize that their day may have been a whole lot worse than yours. Their pandemic may have been a whole lot worse than yours. Now, I'm not saying that, accept abuse and accept verbal attacks. I'm not saying that. I'm just saying before you react, before you combat a situation with defensiveness or hostility, just take a beat. Just take a beat and show some grace. Take a deep breath and then respond to the situation appropriately by thinking first about what is the situation really about. Show some grace. One thing I do to stay front row positive in a balcony negative world is I love Johnny Carson. So I watch Johnny Carson reruns, and I watch Lucille Ball reruns. I watch Eddie Murphy when he was just starting out as a comedian. I love to laugh. So that's what puts me in a positive state, because we could get distracted by a lot of negativity out there. So sometimes when I need a mental break and I just need to be happy again, I just rewatch these really funny reruns, and that puts me in a real positive state. Listen to positive lyric music or positive podcasts. Brene Brown has a great podcast. Oh, great movies that you could watch on Netflix. I remember early in the pandemic, I was telling everybody to watch Self-Made. It's about the first African-American self-made millionaire in our country. And it was like in the late 1800s. It was an amazing, optimistic, resilient story of hope and encouragement. So watch positive stories, watch great movies that just are heartwarming. Do these things. Oh, I love it. Tasha, she watches old comedy sitcoms nightly to make her laugh before she goes to sleep. That's fantastic. Also surround yourself with Colettes. I know you got to witness the amazing Hall of Fame speaker, Colette Carlson, yesterday. Well, she's in my inner circle. I've known Colette for, gosh, what, 20 plus years. And I know if ever I'm having an issue or a challenge, I know that I could call Colette 24 hours a day, 7 days a week and say, I need you. She will be there for me. She will be there and be totally present. And she will give me exactly what I need, whether it's encouragement or I need a listening ear, or she will hold up a mirror and say, Marilyn, but what was your part in it? And because of having a friend that I know and that I love and that I trust, I know that I could call on her. My guess is that if I were to ask you in the chat, if you looked at the people in your inner circle, how many of them are members of the Michigan Women in Finance? My guess is that many of you would say, yeah, my inner circle are the people that I've met through this association. And if you do not have an inner circle, now is the time to get out of your comfort zone and meet the people in this association, because these will be the ones that will be with you when the going gets tough. And then they're also the people that you can go to when you get to celebrate. So you don't have to go onto social media for, and brag about things all the time, but you can go to your inner circle and say, hey, can I just share this win with you? And they are there to celebrate you. Now, please be aware, not everybody's going to be on the happy train with you. There are going to be people who are, no matter how positive you are, they are going to be balcony negative. So here's my tip. You will never read this, even though I am also a sociology major. You will never read this in any coaching book or in any psychology book, but this works for me. When all else fails, my friends, when all else fails, and you are really trying to stay positive, but you're around somebody that just annoys you and you just can't handle it. Here's what you do. You make up a story about their childhood, and it works. It just shifts things. It puts things into perspective. I'll give you an example. I was speaking at a conference in Alaska. And outside of the main door, there was a big sign that said professional development for women. And I was speaking on my first book, Whose Comfort Zone Are You In? How to Lead the Life You Want, Be Happy Every Day. And after my keynote, they rushed the stage and they were rushed my book signing table, and they were all buying copies of my books. And then the breakout session started, and they were like cockroaches. They all went, shoot, they were gone. It's like a light came on and they were gone. So now I'm sitting basking in this positive energy of, I love my job. I love what I do. I love the impact that I made on these women. This is fantastic. And then a complete stranger walks by and he stops. And he looks at the sign and reads it aloud to nobody in particular. And he said, professional development for women? Women don't need that. Women need to stay at home. The crime rate in this country has gone up exponentially since they let women out of the house. The hair on the back of my neck was like, whoa. I mean, it was such an anti-message from what I had just delivered to this group. And I chose in that moment to speak up. And I said, well, you could stay home. And then it hit me. I don't know this man. I'm in Alaska. He could have a hunting knife in his boot. You know what I mean? So I decided I didn't like how I completely let all of my energy be diverted in a negative way to this complete stranger. And I wanted to get back to center. I wanted to get back to my positive energy. So I made up a story about his childhood and it worked immediately. I thought to myself, oh, this poor guy. He was not a popular kid growing up, but he had a crush on the most popular girl in the class. And one day he decided to get her attention and it didn't work. And he wanted to go out with her. And she said no. And so he tried to get her attention by stealing her lunch money, and that didn't work. And so she ran for class president and won. And then because he was so put off by her ignoring him, as he grew up leading a life of crime, he associates women in power with the crime rate in our country. Oh, well, no wonder he feels like this as an adult. It's because of something that happened in his childhood. Now, here's a warning. It's only for your edification. When you make up a story about someone just to help you stay calm, cool, reserved, when you can't speak up, or when it's not appropriate to speak up, or when it's not time for you to say, okay, wait a second, let's get back on track. Whatever it is, try that method. Try just making up a story, not to rationalize or justify, but just to bring your energy. Remember, you deserve to preserve your energy. You got to protect it. So then when you do all of these things, then you get the best seat in the house. And the best seat in the house, I mean, this whole time I've been talking about, you don't want to be stuck in the balcony. You don't want to get in general admission. You want to go to the front row. Well, the best seat in the house, my friends, is not just the front row. The best seat is the usher. If you ever come to Vegas where I live, and I hope you do, and if you ever come to a show when they reopen, and I hope you do, there will be an usher. I guarantee you. And it doesn't matter which show you go to. I guarantee you that usher will have two things. They will have knowledge of all the seats in the venue. They know where everything is. And number two, they will have a flashlight and they will look at your ticket and they will say, follow me. And they lead you to the most direct path to your seat. That's the most fulfilling seat you can be in, is to be an usher for someone else. Everybody has different goals and hopes and dreams and aspirations. When you are leading your best life or living your best life, you are leading people even without you realizing that they can see you. You are walking differently. You are talking differently. You are more optimistic. You are less quick to anger. You are more inquisitive. You are more curious. People see this and they are inspired by that. And what you are doing is you are illuminating the path for other people so that if they ever come to a situation where someone says, oh, sorry, that salary we quoted was a typo, that you can be the usher to say, actually, what they quoted you is what they need to adhere to. And you can get that through this association. You deserve to be in the front row of your life, and the best seat in the house is when you get to usher other people. And I want to end with this quote by L.R. Noss. This was posted in Las Vegas when we had a tragedy here a few years back. L.R. Noss said, "Do not be dismayed by the brokenness of the world. All things break, and all things can be mended, not with time, but with intention. So go, love intentionally, extravagantly, unconditionally. The broken world waits in darkness for the light that is you." So I've been talking about when you change your seat, you change your life. Well, the hope and optimism is that when you change your seat, you have the opportunity to change someone else's life. So thank you very, very, very much for being here. Thank you for all the engagement yesterday. I had a blast meeting all of you. Allison, I'm going to open up, or Annette, I'm going to open it up for Q&A. But that is my time. And my QR code is for free access to my Front Row Friday videos that I do every week. So feel free to sign up for that. So Allison.
Awesome. Thank you so much, Marilyn. So many great takeaways. It definitely just all the stories you told definitely had that perspective shifting effect just listening to them. So thank you for all of that. We do have some time for questions, so I will turn it over to Dina Reed from the board to prompt some questions from the chat box.
Hi, good afternoon. That was great. Thank you. I enjoyed it and got so involved in it. I think that I almost forgot about Q&A. So good news, I'm back to it. And the first question that I was able to field is, do you think public opinion is too polarized?
Public opinion is too polarized. Yes, because I think not everything is black and white. We live in shades of gray. So it's really difficult to have such polarization in our society because there's a reason why people feel a certain way and they vote a certain way. But if you only knew and understand where they were coming from, you would have a little bit more empathy and understanding. So yeah, we are way too polarized, and we just need to take a beat and find out more about why people do what they do and have more of an understanding, and maybe expand our own mindset in that process.
Great, thank you. And you gave us some really good ideas on how to kind of, be positive, and stay focused. Do you have any advice on how to be just more balanced?
Balanced in what?
In to find a more balanced world. We are Michigan Women in Finance. We have careers, we have family, we have all those other things. And besides working on our own, positivity and things that you mentioned, how might we balance all of that with ourself?
Well, it's a very good question, and it's a very common question. And first and foremost, you need to determine what your front row seat looks like. Because if you know what your front row seat looks like, then you can start to say no to those things that detract you from your front row. Some people need to be loved from the balcony, my friend. So you have to set boundaries. I'm about to fly to Seattle, and I'm going to be around some family. We have some, my sister was diagnosed with cancer, and so I'm going up just to be present. But when you're around family, there's drama. So I need to set some boundaries. I need to not participate in all the things that go on, right? I don't want to participate in some of the negativity. I don't want to participate in some of the activities. So, but because I know my front row seat, like for example, I have just lost 63 pounds. And my fear is that when I go back to Seattle, being around old friends and family, I'm going to indulge, especially because we're having a birthday party during the week. And, so I just know that I have a coach that I'm committed to. So every morning I am committed to her coaching by sending her my food journal. So that's my boundary I set for myself, because I've already determined what my front row seat is. My health chair needed to be in the front row because it was in the balcony for too long. So I decided to put my health chair in the front row. And because I know what my front row looks like, then I set boundaries around it. In order for us to have balance, we have to have boundaries. Those boundaries mean we need to learn how to say, no, I have a prior commitment. I'd love to. I can't right now. It depends. We need to have those boundaries so that we don't have all of our energy completely drained by things that can be inconsequential. Let me give you this analogy. You know that you're juggling a lot of balls in the air. You're a mom, you're an actuary, you're a manager, you're a leader, you're a public whatever, right? You're balancing a lot of different hats, a lot of different balls in the air, but those balls are not equal. You have rubber balls that if you drop it, if it falls, it will bounce back. Someone else will pick it up and they will run with it. And then you have glass balls. And if you drop that one, it's going to break, but it can be replaced. But then you have your crystal balls. Those crystal balls are so valuable. And if you drop it and it shatters, you can't get it back. Your job is to know what are your rubber balls, what are your glass balls, and what are your crystal balls. And then you protect your juggling act. You stop taking on rubber balls that someone else could take, and you protect your crystal balls.
Great. That's a fantastic analogy. Thank you for that.
You're welcome.
One other thing you mentioned, and this is a networking group, so I know everyone here is committed to keeping up with that circle or those circles of people that help support them, just like you mentioned. And you mentioned your inner circle, and this kind of ties back to Colette yesterday, talking about all the things being thrown at us every day. And
with blue eyes.
Yeah, it all ties in, right? And so in
Right.
the end, I guess, as we're kind of looking towards closing out the conference, what is your best advice for keeping up with those networks and friends that we know are so important? Is there anything that you do or any tool that you use, a way that you maybe check yourself and make sure that you're being conscious about those friendships and those relationships and the networking for each other and for yourself and for others?
Well, I know that I'm a friend, but I'm also an entrepreneur. I'm a businesswoman. I've been running my own speaking business for 25 years. If I don't put myself out there, I don't get booked. If I don't get booked, I don't get paid. If I don't get paid, we don't eat. So I have to make a conscious effort to keep in touch with people, send notes to people. I send things in snail mail. Can I share with you something that I'm doing now that the masks, hold on.
We love it.
So this is, it's, I like to be creative and clever and keep in touch with people. So what I've just created myself is a face mister that I'm sending out to my friends and my meeting planners, because my meeting planners end up being my friend. And I'm sending face misters because we get to take our masks off. And I've created it where it says, I've missed your face. And so I customize it. I have my own Cricut machine and I customize it with their name. And then it's got my little chair as my logo for your front row seat as a reminder. So that's something I do. That's something that's going out now. Colette already has hers. I also have these little chairs that I paint, and I send these out as little thank you gifts. And it has the message of my speech: energy, attitude, and tenacity, and front row. And then this one's for Abby. I need to send it to her. She hired me for an event. Abby sits here, success sits here, #front row. So I like to be clever. I like to send things to people. Cards always work. I'm not really good with the phone. I don't know why. I don't like the phone quite as much, but I do like to send things. And hopefully then they call me. So just make a conscious effort to know that your relationships, you need to keep in touch with people in good times, so that they will be there for you in not so good times. Because I do have friends that only contact me when they need money, or that they only contact me when there's a fundraiser. And I'm like, where are they when they don't need something? When do they just check in? So I realize that those people don't need to be in my front row, because your front row is high rent district. Don't waste your front row seats with people who do not honor you and love you unconditionally. That was a very long answer to a short question.
It's a great answer, and we really appreciate all of your techniques, tools, tricks, and supportive ways to accomplish this, because we're all struggling with it, and we really appreciate your perspective.
Yeah,
Thank
and
you.
LinkedIn is good too. Sending people notes on LinkedIn.
Yeah.
We all connected here with the WOVA app. You can just start to LinkedIn with people and just to say, hey, how are you? This is how we met. But don't make your first introduction on LinkedIn. Hey, I'd love to get to know you better. Click on my calendar and set up a link so we can. No, don't sell me something. Just remind me how we met, and let's connect. Like Colette talks about, be present and connect with people. And then if there's a good fit, things will happen naturally where you could, refer them for business, for example.
Thank you. That's it from Q&A. I just want to say thank you so much.
My pleasure. It's been great to be with all of you. Thank you for having me. I wish we were in Holland in person, but perhaps next year. But thank you for having me. It was very nice connecting with all of you.
Yeah, thank you so much, Marilyn, for being with us. And I just want to say really quickly too, I mean, what you just said about boundaries, I think I've been seeing the chats roll in about that. I think that's something we all struggle with. So it's about distributing your energy properly. So thank you for all the takeaways today and for being with us.
My pleasure.
Take care. I want to thank everyone for joining us today and yesterday. We really hope the speakers, you were able to find a lot of takeaways to feel more refreshed and empowered. I think many of the speakers hit a point of really the first step of exploring the possibilities comes with the vulnerability of being vulnerable enough to come from a place of curiosity. It's kind of like that cat that Marilyn just showed in the beginning of her segment, that curious cat. Ask questions, be open to different perspectives, so we can all come together and make this the best environment for success. Hopefully we all feel recharged, as I said. And with that, I want to close out too and thank our sponsors for their support on this program. I think, hopefully everyone made it through a lot of their snacks. I know I certainly did from the giveaway box, besides the cookie. I think probably a little bit too cute to eat at this point, but I'm sure I'll find a way to get past that. And, we want to talk about what's to come with Michigan Women in Finance. We're hoping, obviously, to bring everyone, back together again here soon. I know we're all missing that, and, looking forward to seeing more faces soon. And I want to tie in next year's President Annette Jones, as I know more information will be coming soon on our fall networking event.
Hi, thank you, Allison, and hello, everyone. First, please save the date for our 2022 conference, as we will pick up where we left off in May of 2020 and head to Holland on May 19th and 20th. We have high hopes, as Allison has indicated, that we will be able to meet in person at our upcoming fall event. And if everyone can stay tuned for an email announcement, to be coming out in the months ahead. We also post upcoming events to our Michigan Women in Finance website, and we have a Facebook page, so please be sure to like it so that you can stay in tune. Before we move into the closeout session, I would like to take this opportunity on behalf of the entire Michigan Women in Finance Board to thank Allison. Under your leadership, we were able to successfully navigate our team of 19 amazing women and successfully pivot the organization during this pandemic to this virtual platform. Your stewardship has been spot on, and to celebrate your 6 years of volunteering on the board, we are offering you, as you have indicated, a Michigan shaped bowl that has been made by the Holland Bowl Mill Company in Holland, Michigan. We hope that it will remind you of the appreciation for your sense of detail, commitment, and follow through, and with a healthy dose of respect, trust, and friendship that the board and the members have for you. Thank you, Allison.
Thank you so much, Annette. And I do want to say thank you too. I did receive these lovely flowers today, and I'm hoping I don't knock down something as I bring them in. But thank you so much for the board, and truly really excited for you, Annette, and leading the charge to bring us all back together next year. And I just want to thank the board, just amazing women who it's really comes down to a team effort when pulling all of this together. So, and I really encourage anyone who's interested to really submit a board application. There is a link on our website, and we also sent around that within the directories that were mailed out to everyone. And it kind of goes back to what Marilyn was saying about that inner circle, and I think Colette touched on it as well. And I know personally, I have really found that within my fellow board members at Michigan Women in Finance. So I think it's an amazing network. So I would just encourage anyone interested to please reach out to if you have any questions. So on a last note, as a reminder, we will send out recorded versions of the sessions today and from today and yesterday, in case you weren't able to see everything. And we'll also include in that correspondence early next week a survey for the membership. We really want your feedback on the event so we can continue to evolve what we do and adapt our topics that we provide for the conference so that we make sure it's important to our memberships and we're meeting that. With that, we really thank you all for joining this virtual setting. And as we've said a few times, we're very hopeful to see your faces soon, and I hope everyone has a fantastic weekend.